the public will get 2 minutes to present their public testimony, the exception being, of course, commissioners. And so we will start with Commissioner Ellinger and then Commissioner Higgins. Welcome back. And then Cheryl Prey, Jessica Webster, and Ben Gustafson. Following the commissioner, we will try to do 2 testifiers at a time. Thank you. Welcome to the committee.
Good afternoon. Madam Chair, members of the committee, I'm Ed Ellinger, Commissioner of Health, and thank you and to the committee and the Chair for recognizing in your budget deliberations the role that public health agencies, including the Minnesota Department of Health, play in tackling society's most challenging public health issues like the opioid epidemic, the aging of our society with the attendant needs of vulnerable adults, and early child development affected by things like adverse childhood experiences that are all too common. I appreciate the focus that you placed on those in your budget. As you know, prevention must be paired with treatment if we are to have a well-functioning health system. While treatment is crucial, focusing on prevention is really the only rational long-term strategy for turning the curve on healthcare costs for our state and improving Minnesota's quality of life, both today and especially in the future for our children and grandchildren. As you would expect, I approach this budget with mixed feelings because it makes some much-needed investments in protecting our most vulnerable adults, giving our highest-risk children a healthy start in life, and addressing the growing epidemic of opioid use. But it funds those investments with some cuts to those very same programs. First of all, I appreciate the investment in the Office of Health Facilities Complaint, OHFC, which plays a vital role in protecting our most vulnerable adults living in nursing homes and home care settings. While this bill increases support for the Office of Health Facilities Complaints, it funds just a quarter of the governor's revised March recommendation. Investing less than the amount recommended by the governor has serious ramifications for our most vulnerable adults, their families, and for the communities in which they live. OFHC has been working on streamlining its processes, but without more significant investment, OHFC will not be able to double the number of investigations completed because of the increased timeliness of those investigations. It will not be able to communicate and notify families regarding the status of their complaints within the required timeframes. It will not be able to investigate lower-level allegations to prevent them from escalating to situations involving more serious harms. And it would not be able to focus on more efficient case management and improving the IT systems so that more staff time is spent on the core work of investigations and communicating with families. Relating to family home visiting, I appreciate that the Chair and the committee recognize the importance of evidence-based family home visiting as a proven strategy to give high-risk children a healthy start in life. Unfortunately, the investment in this bill is not nearly enough to provide this vital service to every corner of the state. For many children born to teen parents, the achievement gap starts at birth. Teen pregnancy and the need for evidence-based home visiting is a statewide challenge. 51% of teen births occur outside of the 7-county metro area. Without full funding of the governor's request, we will be neglecting the needs of some of our highest-risk children in greater Minnesota. Related to opioids, I appreciate the 2 investments in strategies to prevent opioid use and addiction in Minnesota. We certainly agree that the opioid crisis needs to be addressed, but encourage you to consider grant funds included in the governor's budget that specifically address the opioid crisis in the American Indian community. Minnesota ranks highest among the states in deaths due to drug overdoses among American Indians. There's 25 deaths in 2016. And Minnesota ranks highest in the rate of opioid overdose deaths for American Indians in the nation, 57 deaths per 100,000 of the population. The rate of opioid overdose deaths for American Indians in Minnesota is 6 times higher than that for whites. This is the greatest disparity in the nation and something that I believe we really need to address. Specifically, that proposal the governor awards grants to Minnesota's 11 sovereign tribal nations and to urban American Indian organizations to strengthen their connections between tribal culture and a culture of health, reduce adverse childhood experiences for American Indian youth, and build American Indian communities' ability to advocate for their own health care needs. Moving on to family planning special projects, I'm disappointed to see a major cut in the TANF program, in TANF funding in the Family Planning Special Projects program, which has provided low-income, high-risk individuals with pre-pregnancy planning, family planning services for nearly 40 years. Grants in this program are awarded on a formula basis to 27 grantees located throughout the state. Funding is targeted to individuals who otherwise would have difficulty accessing services because of barriers such as poverty or lack of insurance or transportation, and targeted to women who are at high risk for poor pregnancy outcomes. The program reached almost 30,500 people in fiscal year 2016, providing long-acting reversible contraception and screening for sexually transmitted infections like chlamydia. The loss of TANF funding would equate to an 18% cut to grantee budgets, which would hurt, whether in the shorter hours of service, number of women seen, or access to more expensive long-term reversible contraceptives. Because of greater access to family planning services, Minnesota's teen pregnancy rate is at historic lows, having declined 66% since the early 1990s. This program has a high return on investment because it prevents unintended pregnancies that may occur and otherwise result in inadequate prenatal care, fetal exposure to alcohol, tobacco, and other toxins, and maternal depression. Unintended pregnancies are also associated with economic hardship, child health and development problems, and child abuse and neglect. Related to the fee proposals, the bill also does not include recommended increases to fee programs. Over time, the legislature has chosen to fund 34 public health programs through fees, reaching approximately $50 million, or 10% of our budget. By law, we are directed to bring forward proposals to set fees for those programs at a level that balances costs over time. In fact, this bill expands existing fee programs in some respects. And if we are committed to funding public health programs through fees, then we must commit to raising those fees periodically to cover costs. Without the governor's recommended fee changes, we cannot issue licenses and permits or investigate complaints in a timely fashion, which undermines the purposes of these programs to ensure healthcare practitioners meet state qualifications and standards, prevent contamination of drinking water and blood supplies, and ensure restaurants, pools, and lodging establishments are safe. Relative to the 7% budget reduction, our operating adjustment, while I appreciate the investment in this bill, they come at too high of a price. The bill funds these investments, and all of the things that I talked about, with a 7% across-the-board cut to our general fund budget, and fails to include the operational adjustment proposed by the governor. As you know, the governor has stated that he will not accept arbitrary across-the-board budget cuts in his agencies. He requires that any proposed reductions must clearly explain the programs and services that you wish to cut, specifically what you want state government not to do. As I have testified before, the general fund supports only 16% of the health department budget and is devoted to filling critical gaps between our federal and fee-based programs. Nearly 70% of our general fund budget goes out to grants to local communities, governments, nonprofit, and tribal organizations. Our general fund budget supports the very programs this bill seeks to expand: the Office of Health Facilities Complaints, Family Home Visiting, and the Safe Harbor Program for exploited youth. As indicated by the investments in this bill, demand for our services is growing rather than declining by 7%. Specifically, demand for these general fund supported programs is not declining. We have increased requests for laboratory testing for rabies, measles, mumps, influenza, and Zika, and testing for radiation in the environment near nuclear power plants. We have increasing requests for support for trauma care for rural hospitals to ensure they meet minimum standards for rapid treatment of life-threatening injuries. Increasing demand for work to establish health risk limits for contaminants in groundwater that pose a threat to human health. Increasing requests for technical assistance and funding to local communities to address tuberculosis cases. In fact, we're hearing from communities in greater Minnesota that they need more resources, not fewer, for this particular infectious disease. Increasing requests for services to reduce the spread of sexually transmitted diseases, which are at an all-time high in Minnesota. And reporting of elevated blood leads in children to the appropriate local agencies to follow up for identifying the source of lead and ensure children receive appropriate care. As the governor has also explained, the cost of delivering effective government services grows each year. And while we make tough choices and continuously find ways to do more with less, we cannot maintain the services Minnesotans expect without adjusting budgets to reflect growing costs. At a time when our federal funding may be at risk, it is not prudent to reduce or fail to maintain the services supported by our federal or by our general fund budget. So in closing, Minnesota overall is a healthy state, but faces some significant challenges in maintaining that status. Governor Dayton's budget addresses these challenges in a strategic and effective way. His proposed investments benefit the health of Minnesotans today and in the future. While I appreciate this budget reflects several of the governor's top priorities, the investments in this bill do not go far enough to address Minnesota's needs and come at too high of a price in terms of the opportunities that we have to maintain and improve the health of all Minnesotans. Certainly, I pledge to continue working with you on a budget that addresses these needs and works to make common sense healthcare reforms and smart public health investments to protect and enhance the quality of life for all Minnesotans. Thank you, and I'm open for any questions if you have any.
Thank you. We'll do some brief committee questions, but first of all, I want to thank you for being here. I look forward to working with you as we resolve our differences and come to a fruitful end before the end of session. So thank you very much for your time today and the work we'll do together going forward. Right. Senator Hayden.
Well, thank you, Madam Chair, and thank you, Dr. Ellinger. I was a tad bit late, so if you've answered this, you don't have to be redundant. What are the kind of cuts, and where would those cuts be in your department if this bill was enacted as law?
Commissioner.
Madam Chair, Senator Hayden, the cuts in the across-the-board cuts would affect almost all aspects of our activities. The lead testing, sexually transmitted infections, our environmental health program, our lab, across the board. It's not just limited to the executive office.
So, Madam Chair, Dr. Ellinger, do you still have the arrangement to do health inspections in the city of St. Paul?
Commissioner.
Madam Chair, Senator Hayden, we do the inspections for restaurants in the city of St. Paul.
So, Madam Chair, Dr. Ellinger, would you have to cut in that particular area too?
Commissioner.
Madam Chair, Senator Hayden, obviously, if we take a 7% cut, they're going to affect all of our programs. We would look at how we would have to prioritize, and that's why we actually would come to you to say, what do you want us not to do? Among the things that we do, all of them are really crucial things that have been in place for many, many years, and we would need some guidance from you on what you would like us not to do.
Well, thank you, Madam Chair. Thank you, Dr. Ellinger. I think that kind of illustrates not only the need and the various types of services. I know that the Department of Health has been rated one of the top public health agencies in the country, and it's a list of foodborne illnesses around the world, essentially, most certainly in the country, that we've been able to figure out, but also things that I don't think people would know. For instance, that you do the restaurant and licensing inspection for the city of St. Paul, that most of us here have had lunch today, and probably your folks have been in those restaurants or those cafeterias making sure that the food was safe, at least I hope so. So I just think that this illustrates that not only should we not be cutting in the Department of Health and adding it, but we probably don't realize that a lot of people, maybe the members of the committee do, of course, but for the public, I don't think they always realize the work that you guys do.
Thank you. Commissioner, anything further? All right, thank you, Senator Hayden. Commissioner, we thank you for your testimony today, and we will obviously be in very close touch as we move forward. Linda Higgins, Hennepin County Commissioner, former Senator, we welcome you back to a committee you served so well.
Madam Chair and Mr. Chair and members of the committee, thank you for the opportunity to testify. I'm Linda Higgins. I'm a Hennepin County Commissioner. I'm here on behalf of both my board and the Association of Minnesota Counties, where I am chair of the Health and Human Services Committee. Some things seem to never change. I know you were faced with some very difficult choices in assembling this bill. Deciding what to fund and what not to fund is never easy. To that end, I'd like to applaud your investments in raising the MA reimbursement rates for targeted home visiting. This will help some of our most vulnerable families with newborns and babies get a better start in life. Thank you for the investments in the Safe Harbor program. My county is home to a disproportionate number of the survivors of human trafficking, especially kids. This is work we must do. We're excited about the investments you're making in reforms to our chemical health system. The substance use disorder reforms will be critical in modernizing how we support people in recovery. This is a huge step forward. Having said that, we have significant concerns in areas lacking in investment. My county is home to the largest safety net hospital in the state. HCMC presented several initiatives to ensure its financial viability, and it appears that none of them is included in your spreadsheet. I believe that Dr. Pryor, HCMC's CEO, will be here to testify on some of these unmet needs. Please know that my board and I are gravely concerned about the direction this bill takes on this issue. Similarly, we're concerned about the lack of funding in child protection. Minnesota ranks near the bottom of states in terms of state-level investment in child protection, and this budget does nothing to bend that curve. Rather, this is a burden that will be increasingly shifted to counties and property taxpayers. We are trying to revision how child protection systems function. You may have seen the article in Sunday's Star Tribune about the work that we are doing. That's a very heavy lift for us, more than $13 million in the first year. We need a strong partnership with you. The lives of our vulnerable kids hang in the balance. Similarly, we found no new investment in early childhood development. In Hennepin, we focus much of our property tax dollars on kids in foster care and in child protection. These families really do struggle. Many are on the edge of poverty. This support makes a critical difference in positioning them for success in school and lifelong independence. And finally, counties are seeking investment in the METS eligibility system to accelerate technology improvements that will allow us to better serve Minnesotans on public health care. There is no funding in this bill for improvements in METS. County commissioners from every part of our state have talked to you about this need. The request funding would help us get people the care they need when they need it. Right now, counties have to hire additional staff to meet this need because the state's eligibility system is so slow and obsolete. We in Hennepin County have had to hire more than 50 staff just to meet the current need, not even the future needs. This kind of cost shift is not sustainable to the counties that work with you every day in taking care of Minnesotans. Thank you for all you've done. Thank you for all the work you have left to do on this bill, and I appreciate your work. Thank you.
Thank you. Questions for the commissioner? Right. Thank you, Commissioner Higgins. It's good to see you again.
Good to see you, Madam Chair.
And let's begin going 2 by 2 with Cheryl Prey and Jessica Webster. Let's begin with Ms. Prey.
Good afternoon, Madam Chair, members of the committee. My name is Cheryl Prey, and I am CEO of ARM. I'd like to acknowledge Senator Abler and all the members of the committee for your collaborative spirit, and you clearly have difficult choices that you've had to make in listening to the testimony just now and throughout all of the hearings we've attended. Your support of the DWRS legislation is a real testament to acknowledging the challenges being faced by providers who care for people with disabilities across the state of Minnesota. There are several issues that you have included in this bill that will positively impact our providers and the people they serve. Most notable is addressing the therapeutic leave day issue for ICF services and increasing the residential asleep overnight wage to the minimum wage. Thank you for doing that. I'd also like to thank you for including the funding for the innovation grant. As noted earlier, we are in desperate times and times of change. This funding will provide an opportunity for all of us to collaborate on new ways to create innovative ideas for integrating people with disabilities into the community. So on behalf of ARM and all of the providers that I represent across the state, thank you for all of your support, and especially for that related to the DWRS legislation. Thank you.
Thank you for your testimony, Ms. Webster.
Madam Chair, Mr. Chair, members of the committee, thank you for the opportunity to testify. My name is Jessica Webster. I'm a staff attorney with Legal Aid. Legal Aid represents low-income families, children, seniors statewide. First, I want to thank the chairs for including a modest increase to MFIP cash assistance. It stands to be the first increase in 31 years, as you heard this morning. Deeply grateful for Senator Hayden's longstanding commitment to this issue, as well as the many members of this committee that have advocated for an increase over the years. Legal Aid sees this as a welcome first step to restoring TANF dollars to TANF families, a message that we have shared at the legislature for several years. Obviously, $13 can't resolve 31 years of stagnation, but $13 is not nothing, and it is not insulting to us. For the families Legal Aid represents, $13 can be a pack of 30 diapers that get you through the end of the month. It can be snow boots at the thrift store for children. It's 7 bus fares to job interviews, which need to be gotten to in this program. And it's gas for the car. And so $13 is not nothing. I commend the chairs for taking the action this session to start this conversation. I look forward to restoring diverted TANF dollars from other pockets back to families in the years to come. Legal Aid also wanted to thank you for including language to update the child care assistance provider rate. We have some concerns that the funding impacts, the language impacts the basic sliding fee waitlist, which is currently just over 5,000 families. In addition, we are disappointed that other family-friendly CCAP reforms, including 2 that would better support parents trying to continue their education and support homeless families, were not included in the bill. Members, I thank you again for the opportunity to testify, and thank you for the work that's happening in this committee.
Thank you. Ben Gustafson, Michael Scandrett, followed by Mary Reagan, Shanna Mulville, and Laura Sales. Welcome to the committee. Please proceed.
Thank you, Chairs Benson and Abler and committee members. My name is Ben Gustafson. I work for Fraser, a nonprofit mental health care disability service provider and Minnesota's most experienced and oldest autism service provider. I'd first like to say thank you for your work on the ongoing implementation of DWRS, as ARM mentioned previously. DWRS is among the most critical issues of the session for our families. About 1/3 of individuals living in Fraser's homes will likely see their rates drop by more than 10% when DWRS is fully implemented, and we're extremely concerned with what that will mean for the individuals we serve. On behalf of Fraser families and working families across the state, I want to thank you for your continued work reducing TEFRA fees. Also, thank you for expanding choice and options for people with disabilities by including new services, those being individualized home support services, the employment services, and housing support services, as well as for updating the Minnesota Supplemental Aid Housing Assistance, which will help more individuals find and maintain community-based housing. Further, I want to thank you for not including a 245D licensing fee increase. And lastly, we are excited about the HCBS incentive pool. However, I would like to highlight 3 areas of concern we have. First, we're concerned with the proposed requirement that all staff providing certain services enroll with DHS, which is found on page 176, lines 14 to 22 of the A1 amendment. This could negatively impact individuals by creating administrative burdens and delays. Second, we're concerned with what the basic care rate cut found on page 204, lines 9 to 21, would mean for Fraser families receiving occupational, speech, and physical therapy in a community-based setting. Lastly, I know the chairs and committee members are acutely aware of the workforce shortages in mental health and home and community-based services. And please continue to keep those shortages in mind as you move forward this session. Thank you.
Thank you, Mr. Scandrett, followed by Ms. Reagan.
Madam Chair and members of the committee, my name is Michael Scandrett. I'm here on behalf of the Minnesota Healthcare Safety Net Coalition, which represents Minnesota's nonprofit safety net providers who serve primarily people who are on public programs or uninsured, and often with the most serious and complicated situations, both medical and social and economic. I wish we could come here to say more positive things. I'm going to notice a few things that we can point out, but I think mainly my feeling after reviewing the bill is lost opportunities, because we're really just continuing to pay for the wrong things and not pay for the right things, and that is most of the costs are due to preventable chronic conditions, and we're doing very little to try to keep people from getting sick, and once they start to get sick, to keep from getting more and more sick. And continuing to cut the provider rates when people are trying to deal with the damage that's already been done is not a long-term solution. And I do appreciate, having talked with the members of the committee, that there is, I think, a pretty good common sense of support for the idea that we do need to pay for things differently and to have different levels of accountability and things that we're looking for, but we're not doing it in the bill. And the pain of the cuts is going to just keep getting worse year after year after year unless we really start thinking differently about how we pay for care. So I'll just say this on behalf of the safety net providers. These are the people that will bear the brunt of the cuts because they are serving primarily the people affected by the budget changes that are in the bill. Is we'd like to continue to work with you on damage control as much as we can to try to make the pain that people will feel and the providers will feel somewhat less than they currently are, and would like to come in with some suggestions later on with some amendments that we think we can make more progress towards investing in prevention and health improvement and spending less on damage control. Thank you.
Please proceed.
Thank you, Madam Chair. Mr. Chair, my name is Mary Regan. I'm the Executive Director of Aspire Minnesota. I'm here to say thank you. Thank you for including Senator Ralph's bill that provides funding and support for residential treatment. This will allow us to continue a partnership with counties and the state to provide services for over 700 children on any given day. This is a service that is an anchor to our mental health system, but it is not a solution to the continuum of care. And I can assure you that our members, the bulk of whom provide community-based services, are actively involved in looking at innovation, in expanding other models to make sure that we have the right services in the right place at the right time so that children don't end up in this level of care unnecessarily. I also want to thank you very much for including Senator Lori's language and funding to support young people who age out of foster care without a viable family. This is a small amount of money that will provide a vital safety net for these young people for whom we have taken the responsibility of parenting and will now be able to continue to do so at least up to 21. So thank you very much.
Thank you. And Shauna Mulvihill, Laura Sales, Rebecca Preston, Pam Gonlia, I'm mispronouncing everybody here, I'm afraid, Barty Way. Please proceed.
Thank you. My name is Shanna Mulvihill with Mental Health Minnesota. I want to express my thanks for the inclusion of the mental health innovation grants. We need more and better access to mental health services across the state, especially for those that serve people who need help but do not need a hospital level of care. I believe that this funding will help us create more solutions to meet this need. I also wanted to note that I do think we've made a lot of great progress over the last few years in investments in mental health, including crisis interventions, school-linked mental health, supportive housing, and other programs. And I just want to make sure we don't lose any ground on those. These and a lot of other programs help ensure that we're able to get people the help they need when they need it. They also promote early intervention and treatment and the support people need to recover. We know the symptoms of many mental illnesses start to appear in late teens or early 20s, but unfortunately we also know that a lot of times folks don't get treatment until 10 years or more later. We also know that people living with serious mental illness die on average 24 years earlier than their peers. It's my hope that moving forward we can offer more support for some of these upstream programs and services that can get people help early so they can lead positive and independent and successful lives. Thank you.
Welcome to the committee. Please proceed.
Senator Benson, Senator Abler, and members of the committee, my name is Laura Sales, and I'm with the Minnesota Nurses Association. And I'll just note that in the interest of time, this is not an exhaustive list of what we like and don't like in the bill. So some things we like, the funding for the direct care and treatment security system and electronic monitoring upgrade. I know it's not the same as the governor's proposal, but it is a good start to the funding needed for that. We are happy to see the inclusion of the MA reimbursement for evidence-based nurse home visiting program. Also very interested to see the proposal that gives the legislative auditor responsibility for auditing the managed care organizations. We do want to look at that language a little bit more closely to make sure it's not similar to the House proposals that would have the legislative auditor look at public programs for fraud, waste, and abuse. So want to look at that language a little closer. Also happy to see the funding to protect vulnerable adults in healthcare settings, the funding for the Palliative Care Advisory Council, and the Healthcare Workforce Commission. Some of the things we have concerns about are the cuts to the direct care and treatment operations budget. If I read the spreadsheet, this appears to be a cut to DC&T on top of the 7% DHS central operations cut. So we would just want to understand more about why direct care and treatment is singled out in this manner. In that same vein, we're also concerned that there's no funding for increased staffing at Anoka and St. Peter. We made progress on the staffing issues at those facilities with some funding last year. There's still a lot of work to do to ensure patient safety and worker safety, and these two things would seem to set some of that work back. We're also concerned about the provider rate reductions for basic care and the delays and shifts of payments beyond the budget horizon. We feel like this could serve to further mask the true cost of healthcare services. And then lastly, we were disappointed to see that you did not repeal the sunset of the provider tax so that the funding source for Minnesota Care can continue, and also not including the Minnesota Care buy-in. Thank you.
Thank you. Welcome to the committee. Please proceed.
Thank you. My name is Rebecca Preston, and I'm here to express extreme disappointment that there was no funding in this year's budget to fix the medical assistance spend down. When I testified earlier and met with some of you, you all agreed that this was a very poor policy. So I'm here to ask you, why haven't you funded that medical assistance spend down limit? Raising it by 5% is less than $4 million a year. This would keep almost $50 more in my pocket of my income. And while this might not seem much to you, for me, it means that I can buy healthier foods than what I can get at a food shelf. Most importantly, it would give me, I get confused because of my brain injury. Most importantly, I can remain independent. I don't want to end up in a group home or a nursing home, and I don't want to keep relying on food shelves to feed me. I would love to afford choices. Afford a choice of where I live, afford the choice of what to eat, afford the choice of what to wear. I would love it. I paid into Social Security working 2 jobs before my brain injury. Continuing to take money out of my pocket continuing to take money from my Social Security income is not a way to balance Minnesota's budget. Thank you for listening, but I really need you to do more than listen to me. Please fix the medical assistance spend down. Thank you.
Thank you. Welcome to the committee.
Madam Chair and Mr. Chairperson, my name is Pam Ganella, and I am the chair of the Best Life Alliance and a parent of a child with disabilities. I am asking you to support increased wages for direct care professionals that work in community-based services for people with disabilities in Minnesota. Direct care workers are the hands that provide the quality care that Minnesotans with disabilities rely on in order to live in our communities. I know that you are facing difficult decisions on how to spend limited state dollars, but we are asking you to support these critical services that allow Minnesotans with disabilities to live meaningful lives in the community. Today, direct care staff wages in Minnesota are far below the competitive wages in our economy. This has caused services across the state to face an enormous workforce crisis. If there's not enough staff to meet health and safety needs for people with disabilities, our home and community care services will fall apart. My daughter Sarah loves the intermediate care facility where she lives with 5 other people with severe disabilities. Right now, 1/2 of the staff positions at her house are vacant. The only reason her house is continuing to operate is that the nonprofit that runs it is begging staff that works in other house to work cover shifts at Sarah's house for overtime wages. This is absolutely not sustainable. Providers are scaling back or even closing due to lack of staff. This is of great concern to parents like us. If Sarah's group home closes, where will she go? I'm old and I can no longer care for her full time. I took care of her for 25 years at home. And now, after 3 knee operations, I'm no longer strong enough to take care of her. In fact, the other day I was helping her on the stairs and she unexpectedly leaned on me and we both almost fell down the stairs. Parents, providers, and people with disabilities can't wait any longer. We are asking that as you continue your negotiations this session, to please prioritize funding for much better compensation for direct care workers. They work so hard and they care so much for the people that they take care of. Minnesota has always been a compassionate and responsible state, and it has heeded the call to take care of the least among us. And I am asking you to continue this tradition and support the direct care workers of Minnesota. Thank you.
Thank you. Barty Y, Mary Krinke, Jeff Bangsberg, Claire Sanford, Akira Mohammed, Daniel Yang. Welcome to the committee.
Thank you. Madam Chair, members of the committee, my name is Barty Wahi, and I'm the Executive Director of the Children's Defense Fund Minnesota. Thank you so much for the opportunity today to testify. We believe that we have a moral and economic imperative to ensure every child in every corner of our state has the resources and opportunities needed to reach his or her fullest potential. With smart investment and policy, we believe that is possible. My remarks today will highlight just 2 topics: childcare and the Minnesota Family Investment Program. We appreciate that the proposal before you takes a first step toward addressing low child care assistance program provider rates by tying the rate to the 2016 Child Care Market Rate Survey. However, we are deeply concerned that this change isn't funded when we know it costs around $40 million per biennium. As it currently stands, we have a 5,000 plus family wait list for the basic sliding fee. And without new funding to serve more families, 1,500 fewer program slots will be available by 2021 due to inflation. By not funding the rate increase in this bill, that number in the wait list will grow even further. It is especially disconcerting when we then to see this bill also includes CCAP savings through integrity provisions, but it does not appear that those savings are directed back to CCAP where they are desperately needed. We ask that you spend CCAP savings on CCAP families. We are also disappointed that this proposal does not implement the family-friendly childcare provisions that would align CCAP to national best practices. These provisions have strong bipartisan support and would create stability and consistency in the lives of the children that are accessing the program, not to mention the providers that are serving those kids. They would do that 3 specific ways. They would do that by reducing the disruption in the lives of children, eliminating barriers to continuing on CCAP for families, and finally, to help the most vulnerable homeless families become stable faster. With regard to Minnesota and Family Investment Program, we appreciate this proposal includes an increase to the cash grant. 71% of families accessing MFIP are children. Have children, and more than 2/3 of MFIP families have a child under the age of 6. Children are impacted by MFIP every day. And the cash grant, even with combined with food portion, leaves a family of 3 at about 58% of the poverty line. As this committee knows, poverty in early childhood, especially in early childhood, is correlated with poor childhood and adult outcomes, resulting in long-term costs and heartache for the child. We hope as session unfolds, lawmakers will further expand the cash grant to better reflect the cost of living, since the grant has not been increased in 31 years, and to backfill any TANF dollars used to finance an increase so that programs relying on these funds can continue to work and serve the low-income families they work with. In conclusion, we look forward to working with you as you strive to ensure that every child has a strong start in life. Thank you.
Thank you, Ms. Krinky. And Jeff Bangsberg, Claire Sanford, Hiram Mohammed, welcome to the committee.
Madam Chair and Mr. Chair and members of the committee, my name is Mary Krinky, and I'm with the Minnesota Hospital Association. MHA is appreciative of the funding for mental health initiatives contained in this bill, and particularly for starting the Mental Health Innovation Grant Fund program that we had advocated for. This bill, however, has significant cuts that fall heavily on the healthcare provider community. MHA is extremely disappointed with the decision to delay inpatient hospital rebasing until July 1 of 2021. We have been working on this issue with the Department of Human Services and with the members of the legislature since 2011. It was to have been the first time since 2007 that hospitals were to receive an update in the payment rate. If enacted, this bill would mean that hospitals will not have received a base payment increase in 14 years. The $15.4 million cut this biennium and the $38.9 million cut in the next biennium will have an impact that is doubled with the loss of federal matching funds. There are numerous changes and reforms that should also be considered. Over the last 3 years, inpatient hospital admissions are down and are dropping. We are doing a good job of care coordination and keeping people out of the hospital who don't need that level of care of service. Over the last 5 years, the Medical Assistance Program has produced over $500 million in state savings with the Competitive Bid Program and the Integrated Healthcare Partnership Program. This bill also books additional savings for the IHP program. It would be nearly impossible for hospitals to absorb the MA cuts while trying to provide IHP savings. A hospital can't invest in care coordination, community paramedics, follow-up patient care without the resources to do this. In 2015, 38 hospitals in Minnesota had a negative operating margin. That is 29% of all hospitals statewide, with the vast majority of those hospitals in rural Minnesota. In 2015, the median operating margin for all hospitals was 2.4%. Hospitals rarely like to share this information. It impacts staff recruitment as well as patient perceptions about quality. In closing, we believe the state has a responsibility to maintain a medical assistance payment system that is fair for hospitals and other healthcare providers. We believe this bill jeopardizes that. Thank you, Madam Chair.
Thank you, Ms. Krinky. Jeff Bangsberg, Claire Sanford, Hiram Mohammed, and Daniel Yang.
Madam Chair, members of the committee, my name is Jeff Bangsberg, and for the record, I am not associated with the Minnesota Disability Law Center. That name is after my name. I'm a private citizen, and I'm not employed by anybody to be here today. I'm here to speak with you on behalf of House File 393, which deals with complex personal care assistance services. And I'm greatly appreciative, Senator Ralph, of the bill that was able to make it to this point and was able to provide a 10% rate increase for people who need 10 or more hours of care per day. Those who are living at home, who have the most complex needs, have had the hardest time finding qualified and capable staff. This particular bill requires individuals who provide services for people who have complex needs must have a certain amount of training available or must pass some form of competency evaluation to demonstrate that they are capable of providing care to these individuals in their homes. As it was stated in the other committee in the House, according to the Legislative Auditor's report, there's a severe staff shortage in all home and community-based care services and settings, and I am really I'm sad that we are not able to address the needs for all individuals who are in this particular situation. But again, I'm very thankful that you are allowing for those who are having a very difficult time with this particular care service need. We've lost people. People have died because people who are living at home were unable to find the appropriate care and individuals were sleeping in their wheelchairs overnight because they could not find appropriate care. People could not get out of bed over the holidays because people could not find appropriate care. So again, thank you for including this into your budget, and I look forward to working with you in the future. Thank you.
Thank you for your testimony. Ms. Sanford.
Thank you, Madam Chair and members. My name is Claire Sanford, and I represent the Minnesota Child Care Association, which is a statewide association of about 250 licensed center-based child care providers from small mom and pops all the way up to large multi-site organizations. I'm here to talk about CCAP, Child Care Assistance. I don't envy the work of this committee at all. I can't imagine what it feels like to sit on that side and have to put all these priorities together in front of you. We are very pleased to see the language regarding a provider rate increase to the 2016 market rate survey, but as others have stated, we are concerned about the impact on access it might have, and I'm sure we'll have more discussion about that going forward. However, we have, I know everyone says it and everyone wants a piece of it, an over $1.6 billion surplus, and we're really disappointed not to see any movement on complying with the federal child care assistance reforms. They were bipartisan. They are great policy for kids and families. We can and should do better. If we want families to move off of this assistance, we need to structure the program in order to allow them to do so, which is what these reforms do, with things like 12-month stable authorizations, provisions to smooth the process for homeless families, and more. Without significant investment in CCAP, we'll continue to lose providers, compounding our child care crisis. Over on the House side, we've had a select committee, we've had a subcommittee here, we've had the bipartisan task force, but we don't seem to be acting on it. We study the problem, but we continue to sit on our hands in terms of trying to solve the problem. I realize this is just an opening shot and there's a long road to May, but as you continue your difficult work, please consider the impacts of leaving CCAP to idle, already in crisis mode, and the children, families, and employers who are depending on that. Thank you.
Thank you. Mr. Mohammed, Mr. Yang, Ms. Sirik, Cynthia Leff. Welcome to the committee.
Thank you, Chairwoman and Chairman. Sorry. My name is Ikram, and I'm speaking on behalf of Minnesota Minority Child Care Association, which is an association representing the interest of Somali daycare centers. We have concerns about the upcoming change that would dramatically impact the operation of our centers. In the DHS bill, they're proposing limiting the number of employee dependents that the center can hire. If passed, centers would not be able to have more than 25 children who are dependents of centers' employees. Since many of our parents have multiple kids at our centers, it may mean 3 to 5 parents working at the facilities. We believe that this particular change is going to negatively impact the centers we run, and the centers are run by immigrant communities who have large-sized families. There will be a large amount of people that will be laid off, and also unemployment rates will go up. In Minnesota, child care services are very limited and are very expensive. We at our centers provide critical services to the communities, a high-quality education, and we also employ hundreds of people in the Twin Cities and in the greater Minnesota, St. Cloud, Wilmer, and Rochester, and other communities as well. For many of the refugee new parent comers, we are their first employers. We provide training and skills to become child care professionals and also to seek other employment elsewhere. We also provide them with resources to help them become more connected to the communities and help them create a smooth transition into the new lives in Minnesota. There is a critical shortage in child care professionals, and this would hurt the ability to operate. Chair, Senators, and Ranking Members Hayden, we ask to amend this language in the Health and Human Services Omnibus Bill. We are not opposing the DHS's funding request. We are just worried about the impact this rule will change and it will have on our communities and our centers. We look forward to working with DHS and also as you. Thank you so much.
Welcome to the committee.
Madam Chair, Mr. Chair, members of the committee, my name is Daniel Yang. I'm the coalition organizer for Voices and Choices for Children. Voices and Choices for Children is a coalition that prioritizes the voices of organizations, advocates, and parents of color and American Indians, working across early childhood sectors to more meaningfully engage and empower communities of color and American Indians, many of whom have traditionally been underserved by the existing early education and child development infrastructure. For the past 2 sessions, our coalition's top legislative priority has been fully funding CCAP and increasing provider reimbursement rates to the 75th percentile. Affordable, accessible childcare helps advance opportunity for communities of color and American Indian communities. It's a 2-generation approach to broader family economic security because it helps parents work and children to succeed. More than half of Minnesota's increase in child poverty can be accounted for by the increase in Black child poverty. In addition to the rising level of poverty for children of color in Minnesota, children of color and American Indian children disproportionately represent the majority of children enrolled in CCAP, more than 60%. We appreciate the committee increasing the bill, increasing the CCAP provider rates to the 2016 survey. However, without funding, it will mean upwards of 1,500 fewer slots that will disproportionately hurt families of color. In this moment where our state has a $1.6 billion surplus, folks in our coalition are concerned when is the correct time, if not now, to help and serve our most vulnerable communities. Thank you.
Thank you. Ms. Syrick? Sure. Cynthia Leff, Jonathan Watson, Randall Bachman, Alyssa Light, Sue After Holden. Welcome to the committee.
Thank you, Madam Chairperson. My name is Sue Sherrick, and I am the Executive Director of Care and Share of Crookston, which is a homeless shelter for men, women, and families up in the northwestern corner of the state. I got up at 2 o'clock this morning to drive here today to thank you for the work that you do to help the homeless in the state, specifically the homeless up in our neck of the woods. And I want to share with you the work that we do and the impact that your work is having for us. Specifically, as an agency who acknowledges Homes for All, I would like to thank Senator Hayden for your work on that, and also the rest of the committee for the work that you have done. Care and Share of Crookston houses men, women, and families. And we provide a significant impact back to the community in that our residents help with the sugar beet harvest. They provide an impact that's positive for the community. They provide economic solutions when there aren't enough seasonal workers. Furthermore, our shelter helps to deal with a problem when we have people who are released into the community from corrections that are remanded back to Polk County. We are the only shelter in northwestern Minnesota, from the Canadian border all the way down to Bemidji and Moorhead. When these people come into our shelter, we help them find jobs. We support them. We help network with their parole and probation officers. And we help make them vital members of the community again. Of the people who came into our shelter last year who wanted housing, 100% of the ones who wanted housing got housing. One of our former board members came to me the other day and said, you know, do you have a lot of people in the shelter who have been there for more than a year? And I said, no, we don't have anybody that's been there that long. Our average stay is 57 days. And he said, well, I see a lot of people on the street who I know have been here. And I said, they're community members now. That's the difference that we're making, and it's the difference that's being made because of the work that you're doing and these support programs. It's not just housing, it's getting them the support that they need so that they can get out of poverty and become successful community members. Thank you for all your work.
Thank you. Welcome to the committee.
Madam Chair, Mr. Chair, thank you for the opportunity to testify today. My name is Senta Leff, and I'm the Executive Director of the Minnesota Coalition for the Homeless. We are a member-based organization representing over 100 members in every legislative district in the state, including Care and Share from Crookston, so pleasure to be here. I'm here today to say thank you for including a modest increase to the MFIP cash assistance in your omnibus bill. Thank you to all the members who have worked so hard on this issue over the years, and especially to you, Senator Hayden. I don't have to tell anyone here that $13 a month is not enough. I know and believe that you all know that. But it does press play on a program that has been on pause since 1986. You've gotten the ball rolling on something that no one else has been able to move the needle on in over 3 decades. And I recognize the leadership that it took to do that, so I want to say thank you. I'm also here to speak on behalf of my member organizations and the people they serve. MFIP is a statewide issue, and I have members, as you just heard, in some of the most rural counties in our state. And they call me every week, and they say, I can't be there, I can't make it down to walk the halls of the Capitol, so I want you to make my voice heard. Some of those exact same member organizations used to receive TANF Innovation funding for direct services before the TANF Innovation Fund became a planning and research fund in DHS. These organizations have specifically said to me, my job is to work my way out of a job, and reinstating dollars directly to families is the best way to do that. So I'm here today speaking on behalf of them, and while I understand earlier today there was a lively conversation about whether or not $13 a month was an insult, I was receiving text messages from those organizations and the people they serve, telling me that $13 a month was far from an insult, and they wanted me to help you understand what $13 a month would mean in their lives. So when you're a parent who tucks your kid into bed in the back seat of a car, $13 is not nothing. $13 buys you bus tickets, puts gas in the car to drive significant miles to and from job interviews and mandatory MFIP meetings with your case manager. It buys diapers for a 7-month-old baby. It buys more milk for kids when food stamps just don't cut it. It covers co-pays on prescription drugs. Some have told me that $13 would help them pay for things that would help their kids not feel so different from everyone else. So some moms said, you know, I might be able to buy Valentines for my kids to share with their classmates that day. Or they might be able to attend a field trip. I might be able to pay the field trip charge. So as an advocacy community, we have always advocated for TANF money for TANF families. That's not a new message. We say this without passing any judgment on the services that are currently paid for with TANF dollars. But there are $250 million a year that come into the state of Minnesota through TANF, and less than 15% of them go directly to families. We won't give up on continuing to push for a more substantial increase next year or the year after that, and we trust that you won't either. So thank you for allowing me to bring the voices of my membership to the table today. Thank you for the chance to testify.
Thank you. Mr. Watson.
Good afternoon, Madam Chair, Mr. Chair. My name is Jonathan Watson. I'm with the Minnesota Association of Community Health Centers, represent the state's 17 federally qualified health centers, and thank you for the opportunity today. Briefly, there are 4 provisions in the bill that we do like in the piece in the bill. The quality measurement pieces, I think it's Article 4, Section 3, that narrows and aligns the measurement here in the state of Minnesota with some of the federal measures. We think this is the right direction. We just want to make sure that that stakeholder work group does explicitly include a safety net provider. Safety net providers struggle with a lot of these measures, so if we're going to go back to the drawing board on this, let's set it up correctly this time so there's no penalties for safety net providers just because of the patients that we serve. The second 2 are for the state's integrated health partnerships. There are 10 FQHCs in the state of Minnesota that have an IHP. It's the 3rd largest IHP in the state of Minnesota. There is a piece in there, Article Article 4, Section 24, that provides a care coordination fee. This would be instrumental in terms of building on further success of the IHPs, including the FQHC one. The second piece is in the appropriations article, looking at some of the grants to connect from a data perspective, the IHPs with the social services that their patients use. Having that line of sight outside the four walls of the community health center, particularly for social services, would be very beneficial. And then lastly, there in the appropriations article, there's some dental grants to promote increased access to dental care services in Greater Minnesota. We serve about 18,000 Greater Minnesota residents, their dental needs. So those four pieces. The pieces that I am disappointed in that are not in the bill is namely Senator Abeler's Senate File 1050 that had 3 provisions in it. The first one was rebasing of our medical assistance rates. Like Ms. Krinke said from the Hospital Association, our rates have not been rebased since 2001, so we're in our 17th year without a rebasing of our rates. There was a provision in there to streamline some of our payments from the Department of Human Services so we could actually use dollars to serve patients rather than chasing money that is owed to us. And then thirdly, our community health center appropriation, we're looking to at least level the funding for that program that is really invested into care coordination for our patients, that has really improved health and bent that cost curve. So as this process moves on, I just respectfully ask that you keep in mind the federally qualified health centers to assist you with your budget. Thank you very much for your time.
Thank you, Mr. Bachman, then Ms. Light, Ms. Abderholden, Mr. Berg, Ms. Gustafson.
Thank you. Madam Chair, members of the committee, my name is Randall Bachman. I am the chairperson for the Minnesota Consortium for Citizens with Disabilities, a unified voice for those with disabilities and their families. Our top 3 legislative priorities are consumer-directed community supports, Minnesota supplemental aid and the housing assistance, and also a reduction in the medical assistance disability spend down. Regarding the spend down, as you heard earlier, we're disappointed that there's no funding for reducing the spend down. As you heard before, taking people's Social Security away is not the solution to Minnesota's budget. We are not asking for more money for more services. We are asking you to let people with disabilities keep more of their own income so that they can pay their own bills. How can people be expected to live on $792 a month? While you have been briefed on each one of these priorities, there's a common thread with these and others. And the common thread is this: they are all designed to help people with disabilities live as independently as possible in the community. Another benefit that may not seem as obvious, and one that I want to emphasize, is they are all designed to save the cost of residential or nursing home care, which would be the only alternative if home and community-based care were unavailable. Helping people with disabilities live in the community is not only the moral and legal thing to do according to the Supreme Court's Olmstead decision, it is also the most responsible thing to do. The median annual cost of persons receiving home care is $22,000. Nursing home costs 4 times that amount. And many of the people we're talking about, by definition, qualify for the nursing facility level of care. I trust that all the people who have and will testify have and will touch your hearts. Their stories are compelling. But I'm here today to touch your heads. The state has a $1.65 billion surplus. Surely there is room for funding these programs that help people with disabilities live in the community. If not, then lift the moratorium on nursing home beds. We will need them. Thank you.
Welcome to the committee.
Thank you. Madam Chair, Mr. Chair, Senators. My name is Alyssa Light, and I serve as the board chair of the Reproductive Health Alliance and also the executive director of Family Tree Clinic in St. Paul. The Reproductive Health Alliance is a consortium of family planning providers, leaders, and advocates from across the state. Our 67 clinic locations provide vital health care services to tens of thousands of low-income or uninsured women, men, and families in Minnesota. Our consortium is deeply concerned by the proposed cuts to the Family Planning Special Projects Grant, which in this budget represents an almost 20% decrease in the Family Planning Special Projects Grant funding across the state. The FPSP program provides low-income, high-risk individuals with services that include counseling on birth control options, screening and treatment for sexually transmitted infections, and family planning education services primarily in shelters and other community settings. Unintended pregnancy is a critical public health issue that can have serious consequences for families. For some folks, unintended pregnancies result in poor birth outcomes due to late or inadequate prenatal care, fetal exposure to alcohol and tobacco, and maternal depression, and are also associated with economic hardship, child health, and developmental challenges. In fact, studies show that for every $1 invested in helping women avoid unplanned pregnancies, the Medicaid program saves over $7 in healthcare costs. The RHA clinics primarily serve people who earn less than $900 a month. They're uninsured, underinsured, or on public assistance programs. And our clinics are often the first point of contact for women who are seeking health care for the first time. Just last week, I sat down with a young woman who learned about Family Tree through our FPSP-funded health education programs in a battered women's shelter. And I got the chance to sit down with her because she accessed contraceptive services and cervical cancer screening for the first time in her entire life due to the FPSP funding. And this isn't unusual for our clinics. So cuts in family planning funding will absolutely leave thousands of Minnesotans without care. And it will inevitably increase poor health outcomes for low-income women and their families. It will worsen the already stark disparities plaguing our state. So we know that together we can support our shared communities across the state to live healthy and vibrant lives, and that family planning services are a critical component of that. On behalf of RHA, we hope to work together through the negotiations process that will continue in the coming days and weeks to protect these critical services. And we want to thank you for your time and for your service. Thank you.
Thank you. And Ms. Abderholden, Joshua Berg, Alicia Gustafson, Tony Carter, Mark Sizer.
Thank you, Madam Chair. Members, Sue Abderholden, Executive Director of NAMI Minnesota. And I want to thank you for your efforts to continue to build our mental health system. As you know, we don't have a broken one. We're trying to build it, and we feel that this at least helps move a little bit in the right direction. Certainly, we would have liked to have seen funding for School Linked and First Episode because we know intervening early really helps us down the road, but we do appreciate the inclusion of several things. First was the Mental Health Innovation Grants. We do need to create options to divert people out of those hospital beds, but if they're admitted, we want to make sure that they can leave the hospital when they no longer need that level of care. We know we need to create other more community-based and less expensive options. I would also like to say that we need to look at mental health parity in this instance to make sure that private insurance is paying for this level of services as well. The second is the funding for children's residential. Looking at placing 700 beds at risk was frankly terrifying to us. We certainly do want to develop more intensive services and more intensive options in the community, but we simply couldn't lose the capacity in our current system. We do support the interactive video, targeted case management, the foster care for youth up to age 21. We kind of believe that 26 is actually the new 18, and so, you know, those youth in particular can't do this by themselves. The transition program for youth with mental illnesses as well. I do want to just mention a couple thoughts. One is that for the healthcare training, the mental health professionals were taken out of that pool, and we know that we have a huge, that was in the original bill, we know that we have a huge shortage in that area. And when you look at Medicaid managed care, we also hope that you would look at the payment rates that are provided to particularly the mental health providers and the smaller ones. And then just one other thought is on page 273, the language for School Linked paying for transportation didn't quite make sense, and hoping that I can work with you to figure out what you were trying to do in that particular language, thinking it was perhaps related to the School Linked mental health bill. But again, thank you for making these investments. We think it will really help us as we continue to try to meet the needs of children and adults with mental illnesses in our state.
Thank you. Welcome to the committee, Mr. Berg.
Thank you, Madam Chair and members of the committee. My name is Josh Berg. I am the Director of Services at Accessible Space, Inc. We're based here in St. Paul. We're a nonprofit that provides affordable, accessible housing to individuals with disabilities. I want to echo a lot of what was said earlier, especially from ARM, Fraser, and others, and to touch back on Senator Abler's opening comments about now is a time for change. And I think this bill has some of the reforms that are in it that we need to start doing to actually move the needle here a bit. And there are a lot of us that are willing to think outside the box alongside of all of you as we work to improve the system. There are many things in this bill that are great. Some are good and some are just non-existent. But one of the things that I just want to point out is the requiring of the collection of data related to the workforce stuff, starting on lines 36.15. It's absolutely necessary to collect this data. I think it's a great first step for providers to start providing that information and getting that data there so that we can back up our requests for reimbursement increases and such. So I think this would be a great step. One recommendation I would make, though, is to somehow figure out a way to include private pay in this world. I think it would open the eyes of many, not only with you guys, but the general public, to see the vast differences that private pay individuals face compared to our waivered individuals, and why providers such as ASI, who only accept low-income individuals, which means about 97% of our individuals are on a waiver, we don't have the option as a CEO of a certain hospital in a certain area of our state made a very courageous comment, and yes, perhaps taken out of context, but it echoes what really goes on a lot across our state, where not many providers in this world accept a lot of individuals on waivers because they cap those numbers so that they can make up the difference for the private pay individuals. Thank you for including the housing support services. I think that'll be a great addition for our low-income individuals. Also, just a comment, line 62.28 through 6317, just add in and dump in the requirements into 144D, the housing with services, to kind of get CMS's requirements met for the HCBS final rule. Just keep in mind that 144D is a registration, it's a list, it's unenforceable, and if we're really looking to protect people that receive services and live in those buildings, I think there's other options. Also, thank you for including a really awesome idea for the Home Care and Assisted Living Advisory Council bill that Senator Abler helped chief author for and with me. I think it'll bring some good outcomes to some of the negative stuff that happens on a regular basis. Lastly, I think I just want to say we can start thinking outside the box a bit, and as a city council member of Elko New Market, you know, we see development come into our town, and we have to do the but-for test for developers and when they want to fill in that gap. So I think there's a way that we can maybe apply some of these concepts that don't necessarily relate to HHS stuff, and when we're coming in and asking for rate increases, you know, put it on the providers to kind of demonstrate some of that, and I think we'd be happy to do so. So thank you.
Thank you, Mr. Berg. On the list, we have Elisa Gustafson, and then there's three commissioners. I don't know if you're going to come together, but Ms. Gustafson, are you here? And then it's Ms. Carter, Mr. Sizer, and Mr. Harder, and I presume you all have a list, but is Ms. Gustafson here? Let's do the commissioners. Welcome, commissioners and Human Service. What do you call? You're a Dakota County Community Services Director. And is Ms. Carter here?
No, she's not.
Okay. Well, you can more than, she's amazing, but you'll have to do your best to rise to the occasion. So, Mr. Sizer, welcome to the committee. So,
thank you,
on behalf
Mr.
of the
Chair.
Commissioners. All right, thank you.
Good afternoon. Thank you, Mr. Chair, members of the committee. My name is Mark Sizer. I'm here representing MACSA, the Minnesota Association of County Social Services Administrators. I want to take this opportunity to thank you and share a few comments regarding the language and the funding presented in Senate File 800. First, MACSA would like to thank the bill authors for their investments in two key areas. One, MACSA supports continued state investment in the state's mental health system. We appreciate the mental health initiative grants proposed. However, as a result of legislation in the last biennium, counties are picking up $24 million in cost shifts related to the Anoka Metro Regional Treatment Facility. To give you an example, on a local level, as Stearns County's Human Services Administrator, in 2013, we had expenditures of $443,000 for state commitments. In 2016, that climbed to $2.2 million as a result of these cost shifts. We are glad to see this small down payment, but we hope that moving forward, we recognize that there are significant county dollars in the system, and the state must recognize the sizable investments needed to make a real difference. Secondly, we support the state assisting with costs for children's residential mental health facilities while we continue to work on the continuum of care in the community for this, one of our most vulnerable populations. We are still digesting the impacts of the MnChoices reforms proposed in this budget. We have concerns that the current system does not have the ability to find enough efficiencies to fulfill the savings booked in this amendment. We look forward to working with all of you to find clarity here. I do want to express Max's disappointment that a few items are not included in this bill, particularly in light of the state's budget surplus. Max is disappointed that this budget does not include investments in technology and system modernization, particularly as it pertains to METS. This technology is critical for all 87 counties to make sure that Minnesotans are receiving the most appropriate benefits in a timely and cost-efficient manner. Finally, as Chair Abeler noted in his opening comments this morning, Maxa shares his concern that our human services system is on a collision course with economic realities. We introduced a bill that would create a group to examine our state's human services financing and develop a strategic plan for how all move forward to best support the needs of Minnesotans. Maxa looks forward to working with you in the coming months to develop a budget that reflects a state human services approach to best address the needs of all Minnesotans. Thank you very much.
Thank you, Mr. Sizer. And so on deck, we have Ms. Montanez, Dr. John Pryor, Lori Olson. Welcome to the committee.
Mr. Chair, committee members, my name is Kelly Harder. I'm the Community Services Director for Dakota County. And here on behalf of MICA and Dakota County, I would like to first and foremost thank those who do a lot of the hard work that get all of us here, and that's the committee support staff who do a lot of hard work that allow us to bring forth great ideas, concepts, and future states for the great state of Minnesota. I specifically, on behalf of Dakota County, want to thank all of you for your support in having the data practices modernization language in your bill. As we talk about innovating services, IT, all of that doesn't work if we don't have a modernized approach to how we manage data practices in the state of Minnesota in a way that still preserves the integrity of consent of an individual. It does not compromise that. I also want to thank you for the language included that addresses and creates an opportunity for a couple of us counties to actually modernize and innovate the way that public distribution of funds might be allocated to have a greater impact on the existing public dollar. I didn't say more public dollars, I said the existing public dollar that's available to help support individuals. And finally, that Birth to Aid initiative really is about, you had some great, and I commend all of you when you sit with another committee, i.e. education. These are kids and families that we're all working with collectively, and your optics of legislative priority on that together is really helpful, and we look forward to bringing forth an initiative that can really provide you the responsibility, accountability to get an overall better return on your investment that you're already making between education, human services, and public health. On behalf of MICA, we also want to thank you for the in-reach legislation. Senator Rosen was very involved in providing MA coverage for community-based solutions for getting individuals successfully reentered out of the jail system, as well as the ITV opportunities. We live in a state that has a lot of rural service, a rural need, and that ITV is the exact type of innovation that we appreciate that you're all supporting. And finally, we also appreciate the dollars for innovative grants back at the county level to address growing costs at the Anoka Regional Treatment Center. And with all of that, I just want to sincerely thank each and one of you for your hard work.
Thank you, Mr. Harder. Is Isabel Montanez here? Not seeing her. Dr. John Pryor. And then on deck we have Lori Olson and Christine Furness. Welcome to the committee.
Thank you. Mr. Chair, Madam Chair, members of the committee, I'm John Pryor, CEO at HCMC. Either through training programs or trauma and specialty care, HCMC reaches people in all 87 counties in Minnesota. For example, we participate in the training of more than half of Minnesota's physicians. We operate the Regional Poison Control Center, our state's only 24/7 emergency hyperbaric chamber, the largest of only 2 critical burn centers in the upper Midwest, and we are the backbone of the emergency disaster preparedness system in Minnesota. We are a national leader and partner to the state in implementing public program payment reform efforts, such as Integrated Health Partnership and Hennepin Health. Also unique to HCMC, and this is the important part, is that our revenue mix is comprised of 73% governmental payer sources, 45% Medicaid alone, which is more than double that of any other Minnesota hospital. HCMC is a statewide safety net resource that's critical to Minnesota citizens, and we truly need your help. You have heard from us this year that we are currently facing a financial challenge, and this will not be going away in the near future. HCMC experienced an operating loss of $21 million in 2016, despite, by the way, our journey in lean management and eliminating waste in the system. And therefore, we approach this legislative session with a couple of proposals that have very little cost to the state general fund, but have a great significant financial impact to HCMC. We're disappointed that neither of the proposals that would have helped HCMC deal with our ongoing financial crisis appear in the Senate bill, including eliminating the 1.56% hospital surcharge on our supplemental payments, and intended to help us due to our high Medicaid percentage, which we hope you can consider as this bill moves forward. There is still something, however, you could do to help us in this bill today. Because 2 of the intergovernmental transfers are required by the federal government to end, you could insert language directing DHS when and how to end them. It would help us if you would end the Intergovernmental Transfer 2, that's IGT 2, on July 1st, 2017, and phase out the Managed Care Intergovernmental Transfer beginning on July 1st, 2018, at a rate of 10% per year until 2025. At that time, that IGT would end. By doing the language only, you would make it clear how this federal requirement would happen. Thank you for considering this request for language being added to this bill, and that would be helpful to HCMC. Thank you very much.
Thank you very much, and I appreciate your constructive advice. And so welcome to the committee. Please tell us who you are, and thank you.
Chairs and members of the committee, I am Lori Olson, and this is my co-speaker, Liz Leibenstein. We are registered nurses from Minnesota Security Hospital. I have been employed there for 20 years. We serve 340 patients that are court-ordered to our hospital as mentally ill and dangerous. I work full-time. Because of critical understaffing, I am forced to work 16 to 24 hours of overtime per pay period. I have to stay because there is not a replacement nurse. My family, my children, my friends, and my health suffers. My coworkers are in the same situation. Our organization is unable to recruit new nurses because wages offered are too low. Recruitment bonuses, tuition, loan forgiveness, and retention bonuses are industry standards and are common and expected benefits in the nursing industry. Burnout and low compensation due to inadequate funding are causing more nurses to leave than we can hire, leading to a circle of forced overtime. Please support the governor's proposal and fund our critical staffing ask for Minnesota Security Hospital.
Thank you very much.
Overtime at our facility.
Oh, please tell us who you are.
Oh, I'm sorry. My name is Elizabeth Liebenstein. I'm an RN at the Minnesota Security Hospital. I work on the admissions and with the most unstable patients in our facility. They are experiencing high levels or lots of symptoms, and they're court ordered to be at our facility. They're all mentally ill and dangerous. Overtime is well above safe levels in our facility. Staff are required to work, when staff are required to work the amount of overtime that they are working, mistakes happen, medication errors happen. Staff become less aware of their surroundings, putting them and their coworkers in jeopardy in an already dangerous facility. Last year, 100 staff were injured completing their job. by patients. Some were severely and permanently injured. Cutting our operational budget and not funding more positions will continue to put staff and patients at safety at risk in our facility. We just ask that you support the governor's proposal and look at funds for our facility.
Thank you very much.
Thank
Thanks
you.
for coming up. Is Ms. Furness here? And then we have Ann Krusnick and Tara Gibbs is on deck, or in the hole. So Ms. Krusnick, you can come up too. Yeah, thanks. Welcome.
Thank you. Thanks for hearing me today. My name is Christy Furness. I'm a Minneapolis resident. I've lived in Minnesota for 25 years. I've been married for 5, and I'm an artist, and I have a diagnosis of schizophrenia. Schizophrenia is a disease of the brain that causes symptoms such as hallucinations, delusions, paranoia, mood disorders like depression. Mix all those up, and that's what I've got. I'm on Medicare, and I'm on a program called MAEPD, which is medical assistance for employed persons with disabilities. It takes a lot to fight off the symptoms of schizophrenia. Supportive friends, family, community support programs, exercise, eating right, staying off drugs, stable housing. It's all very important. But I would not be able to be here today and talk to you if it were not for the medical attention that I've received with government support. I have a therapist that takes my MA. She has helped me sort through difficulties and celebrate achievements. She also helped me to find a psychiatrist who, with a lot of knowledge and a lot of patience, has helped me find the correct medication combination. And I've also found a pharmacy that the employees remember my name. This may seem very expensive, maintaining my health, but let's be clear. Without these people, without this medication, I would not have a part-time job that I just celebrated my 6th year. I would not pay the state sales tax on the art sales that I've made as a small business. I would not be facilitating an art workshop at the Walker Methodist Memory Loss Care Center in April. And I would not be working on writing a book to help others with similar diagnosis. At the best, I would be in and out of the emergency room. I'd be couch hopping or in a shelter. I'd be trying to self-medicate, which people do, because psychosis is uncomfortable, and you try to stop it any way you can. But most likely, I would be institutionalized, incarcerated, or dead. So I ask you today to consider my story and the stories of those who are unable to stand in front of you, all of your constituents, all Minnesota citizens. Consider the bottom line. Each person has a right to be a contributing member of society. Every person has a ripple effect, and each and every person's health benefits the health of Minnesota. Thank you.
Ms. Furness, thank you very much for coming, and I know it was hard for you, but you did. It was very good to hear from you, so thank you. And we all wish you the best.
Thank you very much.
Ms. Krusnick, welcome to the committee.
Thank you, Mr. Chair, members of the committee. Thank you for letting me testify. I'm Ann Krusnick with the Joint Religious Legislative Coalition, which is made up of faith communities across the state that are Catholic, Protestant, Jewish, and Muslim. And I want to address 2 aspects of the bill in regard to MFIP. First, I want to thank the committee for including the JRLC bill to address the marriage disincentive that's inherent in the MFIP program. We know that marriage is a valuable tool in moving families out of poverty, and hope that that will make a meaningful difference in addressing that. Also want to address the MFIP increase. We appreciate the comments of people that this isn't enough, and we agree that it isn't. Long term, we need a significant contribution if we're going to try and make those families equal to where they would have been without the erosion of the MFIP benefit. But the increase included is very meaningful. It'll make a very real difference in the lives of families with diapers and underwear and socks that wear out and paying on, bills for a variety of things. So I just want to thank you for including that in the bill.
Thank you very much. Is Tara Gibbs here? Mr. Euland, I think you're here. And then Ms. Palin, if you want to come down, and Ms. Butcher is on deck. Welcome to the committee, Mr. Euland.
Thank you, Mr. Chair, members of the committee. My name is Joel Euland. I am the Public Policy Director for UCARE. UCARE is a health plan that serves approximately 160,000 members today, but by May 1st, we will be serving more than 300,000 members as we begin to serve the PMAP and Minnesota Care contracts formerly served by Medica. I'm here to testify on two issues. First, I'm here to support the Legislative Commission for Managed Care that was included. While UCARE continues to advocate for changes that can take place immediately to prepare for any future managed care procurement process that DHS may be considering, the Commission is certainly a good start and a place to review and examine some of the key issues that came from the 2015 procurement process. I do need to raise some concerns, though, that I just ran over from the house, so I'm trying to catch my breath. I do need to raise some concerns that my health plan has with the proposed payment delays, starting on line 722 of the spreadsheet. Payment delays are certainly not a new tool, and this is something that Senator Lori alluded to this morning. It has been done on a bipartisan basis from legislators for more than 10 years. However, the scope of this shift is daunting, especially for a health plan that is smaller like mine and has 2/3 of our future enrollment coming through state public programs. It is also important to understand that delays and withholds reflected here is not the only payment delays and withholds that health plans have. There are already existing payment delays and withholds, particularly in the area of performance and non-performance withholds that already exist and have been part of the state statute book for a number of years. And so this is an additive effect to that. Payment delays do not impact each health plan equally. In recent years, UCARE has had to consider enacting a line of credit in the months of June simply because we would have exhausted our reserves during that period of non-payment from DHS. This proposal exacerbates the situation by forcing us to draw down our reserves sooner, forcing us to incur additional interest payments, and in some situations delays for our payments to providers. Lines of credit is also an additional administrative expense that we are forced to incur at the same time that the legislature has been trying to find ways in recent years to make sure that we are limiting the amount of administrative expenses that we use. I hope that as this proposal continues to move forward, there is consideration as to what the financial impact of this proposal is on the health plans, and that there should be some consideration about the expenses that are incurred by us by trying to identify lines of credit. Thank you for the opportunity to testify.
Thank you, Mr. and thank you for running over. Senator Lori.
I'd just like to note that this was the first we've heard of the Legislative Commission for Managed Care. I'd just like to remind the chairs that I did bring up this morning, and it's not Mr. Euland's fault, but we don't know what policy's in this bill yet. I mean, it's been, It was in this committee, but we didn't know that it was in this bill until just now. We haven't gone over the policy provisions in this bill. They're kind of, we may have heard some of them as they were developed, but I don't know what all policy is in here. I have not had time to read the whole 440 pages.
See, now you have no problem with the messenger.
I hope, no, the messenger's fine. And when we saw the Legislative Commission for Managed Care, I think it is a decent approach, but it's one of those, I don't know how many, there's not that much in this bill. I don't know how it got to 440 pages. I'm assuming there has to be a lot of policy in here. And at some point, I'd like, again, to know what that is. We've now had one of them brought up.
Thank you. I appreciate it. So it's not you. We're very happy with you, Mr. Euland. Clearly, as a committee, we are unanimously in favor of you. So thank you. And Ms. Palin, we're eager to hear from you. And then on deck, we have Ms. Butcher. So welcome to the committee.
Thank you, Mr. Chair and committee members. I am Ginny Palin with the Minnesota Association of Community Mental Health Programs. We are a statewide association of 36 community-based mental health programs, serving everyone who comes to us, regardless of their income, insurance status, where they live, or their ability to pay. I would echo the sentiments of many of the testifiers who came before me. I understand and appreciate the budget target constraints you had to work within and the tough decisions you had to make with that. And so I want to thank you for including some pieces related to mental health, specifically including the Mental Health Innovations grant funding. We believe that this is a great investment into community mental health infrastructure and the continuum of care, and also for funding children's residential mental health services in the IMDs. We're also concerned about the potential loss of the progress we've made in the mental health system through upstream services that we did not see included in this bill, including pieces such as the schooling to mental health grants, early intervention, and crisis response. We're also disappointed that certain provisions that we'd been working with were not included in the bill specific to some of our priorities, including Senate File 927, which would look for a rate increase for mental health services, sustainable payments, and also ensuring that full payments are received by providers who are working under managed care contracts. Also, Senate File 1341, which would expand access to telemedicine services in mental health services. With that, though, we look forward to partnering with you and the rest of the legislature on these pieces and additional proposals as we move forward through the process. Thank you very much.
Thank you very much. And on deck, we have Mr. Vogel and then Mr. Bauer. So welcome to the committee.
Thank you, Mr. Chair and committee members. Thank you for receiving this testimony. My name is Lynn Butcher. I'm an employee of the Minnesota Department of Human Services Direct Care and Treatment Administration in support of the Minnesota Security Hospital and related forensic programs. I'm also a member of the Minnesota Association of Professional Employees, a union representing 14,000 professional employees who do the work of the state of Minnesota, including psychologists, social workers, behavior analysts, research analysts, occupational therapists, recreational therapists, licensed alcohol and drug counselors, and many more, including training and development specialists like myself. I come today to express my disappointment that this committee did not include the governor's funding request for an operation increase for direct care and treatment and additional funding for staffing for the Minnesota Security Hospital. It has been over a decade since we have had a meaningful increase in our operating budget for direct care and treatment, which is the de facto mental health system of Minnesota. We take care of people who are committed to the care of the state for mental health issues or because they cannot care for themselves. And in the Minnesota Security Hospital, we take care of Minnesotans who are vulnerable because their mental health issues put them at risk for public safety. 2 years ago, the legislature passed the 48-hour rule requiring us to take people who are in county jails within 48 hours, but they did not pass any appropriation for additional beds. This has put a huge strain on our system. Minnesota Security Hospital, when compared to other facilities across the nation that are like ours, and we are not unique, has 300 fewer positions to care for the Minnesotans in our care. This is mental health professionals, social workers, occupational therapists, food service workers, janitorial services, administrative support. We are lacking. We are not fat, we are starving. I do not believe that the members of this committee are cruel because I believe in the fundamental goodness of people. I see it across the state as I travel to our direct care and treatment facilities and work with our teams so that they are competent and confident in carrying out the state's work. I speak with Minnesotans every day, and when I tell them what I do, they bless me and they thank me and they ask me to continue the good work. I ask this committee to help me and my coworkers do that by funding our programs. Thank you.
Yeah, thank you, Ms. Butcher. We thank you too. So I appreciate you coming forward. Then on deck we have Mr. Bauer and then Ms. Kmitt and then Mr. Pearson. Welcome, Mr. Vogel.
Thank you, Mr. Chair. Committee members, my name is Ethan Vogel with AFSCME Council 5. AFSCME Council 5 is opposed to this budget proposal. At a time when our state has a budget surplus, we believe we should be not making cuts, but investing that money. We should be investing in safe staffing levels for workers who care for mentally ill and dangerous patients. This proposal completely ignores our safety concerns. We believe the legislature should be investing in an operating adjustment for the Department of Human Services, not threatening to cut their operations by 7%. An operating adjustment will allow DHS to plan for and respond to future challenges, whereas a cut of 7% will create additional challenges while simultaneously undermining their ability to respond. And the same goes for the 7% cut to direct care and treatment operations. This is really a dangerous proposal. It will remove direct care staff from the workplace, and it means lower staffing ratios, and it means that the remaining frontline workers will be left to suffer the physical consequences of chronic underfunding. So as you move forward, we encourage you to reconsider these proposals. We also encourage you to make the full investment in the CABS program, as well as the security system and electronic monitoring upgrades within direct care and treatment. And of course, this is not an extensive list of our concerns, Mr. Chair. Thank you for your time.
Thank you, Mr. Vogel. And on deck, we have Ms. Kmet. Mr. Bauer, welcome.
Well, thank you, Mr. Chair and members, for a couple minutes to spend with you today. A couple specific thank yous in this bill. First of all, thank you for including Majority Leader Gazelka's Senate File 531, Safe Harbor for Sexually Exploited Youth. As you know, and as you've heard from me for a number of years now, this will help us serve even more youth who have been sex trafficked around the state, both with safe shelter beds and with supportive services. So thank you so much for including that. I also want to thank the committee for including Senator Ralph's Senate File 663, which, much like we did in 2012 before building Minnesota's Safe Harbor for Youth system, puts in place that same planning process for adults who have been sex trafficked in the state. So thank you for that. And a couple other just final thank yous. One, I always have to thank Senator Laurie for the years leading up to this year on building the groundwork for our Safe Harbor system. I appreciate you. And the staff shout out for the day goes to Mr. Albrecht, who I think a 31-page spreadsheet in less than 2 hours might be a record for you. I don't know if the committee confirmed that, but thank you for your adept handling of all of this along the way and helping me with language along the way. Thank you, Mr. Chair and members.
Thank you. And then on deck, we have Mr. Pearson. Welcome. Or actually, Mr. Pearson, come up here. Ms. Thurlow is on deck. Welcome, Ms. Kmet.
Thank you, Mr. Chairman and members of the committee. My name is Catherine Kmet, and I represent the Minnesota Council of Health Plans, which is the association that includes Minnesota's 7 nonprofit health plans. Thank you for all of your hard work in putting this proposal together. As Joel Yulin mentioned, I want to talk a little bit about the payment shifts and payment delays. The council is concerned about these shifts being used to fund ongoing needs with one-time money. I want to make sure the committee is aware that the state already imposes managed care payment delays and shifts that total approximately $1.1 billion. That's with B, a billion. Despite these existing shifts, health plans continue to reimburse the cost of doctors, hospitals, prescription drugs, medical devices and procedures, et cetera. When payments to the health plans are delayed or shifted, health plans use the reserves to cover these claims. The health plans are in a different financial position than they were 2 years ago. Health plans have continued to pay out hundreds of millions of dollars in claims, even though the premiums collected have not been enough. The losses in the individual market, combined with the losses in state public programs, have reduced health plan reserves considerably. Most health plans have about 2 to 4 months of reserves on hand. The proposal in this bill is requiring health plans to spend additional reserves in a way that is not sustainable. We are also concerned about the language in Article 5 relating to expanding networks and expanding access to primary care providers. We understand the underlying issue, but the committee needs to recognize that every additional requirement added will increase upward pressure on premiums. We are particularly concerned that the two network provisions and how they will interact. They could have the opposite effect of carriers not being able to meet these mandates. There is another set of audits for HMOs in this bill. The health plans are heavily regulated entities. They already are audited by many regulators, including CMS, the Department of Commerce, the Department of Health, the Department of Human Services, as well as third-party audits contracted and paid for by the health plans. We want to work with the committee members to better understand how the new auditing requirements will work. And finally, we need to understand better how the dental carve-out process will work and look forward to working with all of you as this process continues. Thank you for the opportunity to testify.
Thank you, Ms. Commit. And Ms. Dilla, why don't you come up? Oh, did you have a, Senator Hayden, sorry, I wasn't paying attention.
Good. Well, thank you. Thank you, Ms. Chair. Thank you, Ms. Commit, for coming. I am just wondering, and I don't know if you can answer this question. So we have spent a lot of time with the members of your organization and even you about trying to cover Minnesotans on the public programs as well as in the individual market. So with the proposed shifts in payment, what kind of effect do you think that that might have on the folks that are serving your members, the health maintenance organizations that are, or MCOs that are serving us? So I guess a better question is, do you think that this would have an impact on them being able to serve the folks on the public plans?
Ms. Commit.
Mr. Chairman and Senator Hayden, I think that it's going to affect different plans differently. Some plans may be better able to weather these types of shifts, but I think that for other plans it might be more difficult.
Senator Hayden.
And then, Mr. Chair, Ms. Commit, in kind of this ecosystem that we're in, do you think that there'll be an impact on the organizations you represent by a rate cut to hospitals?
Ms. Commit.
Mr. Chairman, Senator Hayden, I'm not exactly sure if I'm following your question. Are you wondering if there's a cut to hospital rates that will affect the health plans somehow?
Well, Senator Hayden, there's a rebasing elimination, but there's no rate cuts to hospitals. So they're just and the 2.3% it carves out hospitals.
There is a cut to hospitals, but not through managed. That's a fee-for-service cut, but it is, I mean, it does apply to hospitals, is my understanding.
No,
I mean, we asked for details on that. We haven't been, we haven't gotten
I'm just telling you it
them
doesn't. I'll show you the list, but it does not. I'm just telling you it
yet.
doesn't.
It does not apply to hospitals?
The 2.3, no.
Either inpatient or outpatient?
Neither. Ms. Committ's shaking her head.
Okay.
Just to be, I mean, ask your questions.
I don't know. I mean, it's fee-for-service though, right, in any case?
Yes, and I'll read the list. Well, I just wanted to make sure we're asking the right question. So
Well, thank you, Mr. Chair.
I
think that that's helpful, and I think as we go through the policy that I did, I think what I was getting at is just trying to figure out is when we make these shifts, when we don't pay our bills on time, does that have, because I've heard of, or the plans have been in front of us that says that there are all these various reasons in which they had to leave the Medicaid market, leave the individual market. I don't want to mix apples and oranges before someone says that, but I was just trying to get a sense from Ms. Commit, and it might be a broader and a bigger question about if we're not paying on time appropriately. I hear them saying that they're not getting enough to cover the cost. Would that have an effect on their ability to be able to serve this population, is what I was trying to get at.
Ms. Commit.
And Mr. Chairman and Senator Hayden, I apologize for not fully understanding your question. I do think there is going to be an impact. It just makes it harder. Health plans will continue to reimburse providers, hospitals, doctors, et cetera, but that will, they take that money out of their reserves to make those reimbursements, and then that can in turn have a financial impact on them and even put some plans at risk of having financial difficulties.
Thank you, Mr. Chair. Thank you, Ms. Commit.
Thank you. And now we have a duet. And then on deck, we have Ms. Spica. Welcome to the committee.
Mr. Chair, members, my name is Toby Pearson, here today with Care Providers of Minnesota, representing the long-term care imperative.
And good afternoon. I'm Carrie Thurlow with Leading Age Minnesota, here also on behalf of the long-term care imperative.
At the beginning of the session, we outlined principles that we were using to evaluate the governor's proposal, and we would use those same principles to evaluate this proposal as it moves forward. Just to remind you, the way we are evaluating those proposals are the following 3 items. We believe that seniors should live independently for as long as they are able, with access to the services they need in the communities that they call home. The state of Minnesota should provide seniors and their families with the flexibility to choose the best options for care while continuing to encourage innovation, quality, and value-based decision-making. And caregivers should receive the support they need to make older adult services a successful and stable career. It's based on those 3 principles that we have evaluated, and I will let Ms. Thurlow go through kind of the ups and downs of this proposal.
Ms. Thurlow, welcome.
Thank you, Mr. Chair and members of the committee. And for the most part, we're very pleased with the budget that's presented today and want to thank the chair and the members of the committee for the really good work and the positive progress forward in getting ready for our growing senior population. I want to first touch on and thank the committee for including a phased-in proposal to begin the work on reforming our elderly waiver payment system. As a reminder, 60,000 Minnesotans are turning 65 this year and every year until the year 2030. And we view that elderly waiver reform, the program that pays for nursing home eligible residents for services out in the community, is a really important step to get ready for that aging population. The proposal in the bill reflects about preparing, and it also reflects about providing access for seniors so that they can receive the services they need in a place that they call home, and avoiding a more expensive nursing home placement. As a reminder, currently we serve 30,000 seniors on this program. It covers services from assisted living to adult day to Meals on Wheels and transportation, and so we thank you for that positive step forward. Also in the bill is some really good work on phase 2 of implementation of the value-based reimbursement system for care centers, and want to especially recognize the good leadership of Senator Lori and the committee members on working on this issue. We've already seen tremendous impact of that new payment system for care centers, and as a reminder, this proposal actually saves money in the budget, and appreciate that being included. There are investments in workforce efforts aimed at addressing the shortage of professional caregivers, including investments in extension of the nurse loan forgiveness programs to nurses working in assisted living and home care settings, and also some additional flexibility for the skilled nursing facility scholarship program, so we appreciate that. And there is also regulatory reform that we appreciate, including the exemption for housing with services to the lodging law, and clarifying and trying to clear up that confusing aspect, and funding of some OHFC enhancements as well. I'd be remiss if I didn't pause and express some concern for one policy item in the bill, which appears on line 380.21 in the bill, which create some new restrictions on change of living for units in housing with services. We shared our concerns in committee when this bill was first presented, and we continue to have significant concerns about this proposal because it would prevent an ability of a landlord to move a resident for any reason, including if the resident is unable to pay for the rent of that current unit, or health or safety reasons, or any other reason. We pledge to continue to work with the author on this provision, but at this time we do want to point out that we continue to have concerns with that provision. So with that, I'm happy to answer any questions.
We are just satisfied with your testimony. Nobody has a question. Thank you very much. On deck, we have Mr. Dick, you can come down, and then on deck we have Mr. Godboy, or Ms. Linden Godboy, sorry. Welcome to the committee.
Good afternoon, Chair Abler and members of the committee. My name is Summer Spica from SEIU Healthcare Minnesota. I am a home care worker, and I have also hired PCAs to care for my husband who has MS. We are disappointed that the omnibus HHS bill does not include the provisions of the governor's budget that fund a rate increase for both home care workers covered by the SEIU contract and the traditional PCAs who would get the same rate increase. Obviously, with your budget target, it is hard to make investments. I want to remind you that because of the low wages and benefits, it's nearly impossible to find qualified home care workers. Both parties recognize we are in crisis. I would like to thank Senators Miller, Abler, Lori, Housley, and Hoffman who authored SF 2066, the standalone bill to fund our contract. That bill, which mirrors the provisions in Governor Dayton's budget, invests $48 million with equal federal matching funds to increase wages and benefits for over 50,000 home care workers, including the 27,000 self-directed workers covered by the new SEIU contract. For those self-directed workers covered by our contract, the minimum wage will be $13 an hour. There is an extra 10% rate increase for clients with complex care needs. A new voluntary online matching registry will make it easier for clients to find willing, qualified workers in their area. Training opportunities are expanded and paid time off accrues more quickly. This last part is important to me because I remember not having PTO and going back to work too soon after giving birth by cesarean section. I did it twice, once a week after having a C-section and once 4 days after having a C-section. It was one of the hardest things I've ever done. Even though they are not covered by our contract, the bill also provides an equal rate increase for the traditional PCA program, where private agencies hire and supervise the worker for the client. Finally, no worker is or will be required to join SEIU or pay any fees to our union. Clients and responsible parties also maintain the right to direct their care, including hiring, supervising, and firing any caregiver. As you negotiate a final package with the governor and the House, please remember these tens of thousands of workers and the people that we care for. Thank you.
And thank you for coming. I appreciate it. After Mr. Dick, we have Lyndon Gaboy, and then on deck, crowd. Anyway, so welcome to the committee, Mr. Dick.
Thank you, Mr. Chair and members of the committee. My name is Eric Dick, and I'm here before you on behalf of the Minnesota Medical Association, the state's professional association of physicians and physicians in training. As is always the case with a budget of this size and scope, there are provisions that the MMA supports and those with which we have concerns. The MMA is grateful for the inclusion of Senator Jensen's Senate File 1340, the effort to better align state quality measures with those implemented at the federal level. The MMA strongly supports the use of quality measures, and this provision will reduce the administrative burden associated with compliance with these measures. Physicians recognize the tremendous damage associated with the abuse of opioids, and the MMA thanks the authors for including several provisions intended to stem the tide of opioid addiction and overdose. The MMA has devoted significant internal resources to furthering prescriber education around opioids, and we are strongly supportive of the grants that are included in this bill. And finally, the MMA appreciates that the authors have left significant surpluses in the Healthcare Access Fund. With the uncertainty of healthcare reform in Washington, D.C., and the pending repeal of the provider tax here at home, we believe that leaving the Healthcare Access Fund intact is the wise and prudent thing to do. Regrettably, the MMA must oppose the bill's proposed provider rate reduction for basic care services. Earlier this session, the MMA came before this committee and shared that reimbursement for physician services is woefully inadequate and in many cases does not cover the cost of providing the services. Medical assistance reimburses less than Medicare and far below commercial insurance payers. Continued cuts to already low reimbursement will lead to further cost shifting to private payers and employers and may lead to access issues. And finally, we are disappointed that the budget does not include the prior authorization reforms carried in Senator Nelson's Senate File 593. The HHS Finance and Policy Committee heard Senator Nelson's proposal last month, and it was roundly and warmly received in a bipartisan fashion. In many instances, patients are selecting health plans specifically because of the coverage that they offer, and yet nothing in state law precludes a health plan from changing a formulary in the middle of an enrollee's contract year. Inconsistent and unnecessary prior authorization hurdles cause significant administrative burdens for physicians and other prescribers while risking patient health. Thank you, Mr. Chair and members, for the opportunity to speak.
Thank you, Mr. Dick. Welcome. Thanks for that. I think the welfare rights folks had a goal, so they've had some of their comments mentioned by other people. Is Beth Fraser or Jesselyn Ackerman Frank here? And then Susie Mischatz, and then on deck is Ms. Lawrence.
Hi, Mr. Chair and committee members. I'm Beth Fraser with the Commission of Deaf, Blind, and Hard of Hearing Minnesotans. And sitting here is sobering, listening to all of the testimony and all of the programs that you were not able to fund. And so it is with even more thanks. I want to thank you, Mr. Chair, and committee members for providing the funding for the Deaf and Hard of Hearing Services Division. As you heard when we had our testifiers here, this will provide critical funding to people who are deaf-blind, to parents of children who are deaf-blind and deaf and hard of hearing, and help modernize the service system so that it can continue to provide services throughout the state of Minnesota. So thank you, committee members. Thank you, Mr. Chair. Thank you, Senator Hoffman, for authoring this legislation. Thank you.
Thank you very much. And, Ms. Schatz, I guess. Good. It's fine. Stay in order, not going to confuse people. On deck, we have Ms. Moriarty. So welcome to the committee.
Great. Thank you, Mr. Chair, members of the committee. My name is Susie Schatz. I'm from Lutheran Social Service of Minnesota and the Minnesota Consortium for Citizens with Disabilities. First, I want to thank Senator Abeler for his attention to services for people with disabilities as far as moving folks into more independent settings, especially the incentive pool that will allow providers to apply to do some really innovative things on community integration, employment, and living. Also for investments in DWRS, including the governor's three employment proposals from the governor's budget as well. And Senator Lori, thank you so much for your attention and support with the Minnesota Supplemental Aid Housing Assistance and the increase in income support. We're really excited to see something in this budget and can hopefully move that forward and see some savings from that in just a couple short years. If there's opportunity, we would love to see the MA spend down increased and also CDCS budget methodology changes. And finally, we want to thank you for your attention again to Safe Harbor for Sexually Exploited Youth, which there are areas of Minnesota that will definitely be able to access those services where they weren't before. So thank you.
Thank you very much. And then Ms. Moriarty can come down, and then Mr. Weiberg. And so welcome, Ms. Lawrence.
Thank you, sir. My name is Sarah Leverins. I represent the members of AFSCME Council 65, which is a union representing 14,000 public and nonprofit employees in Greater Minnesota and South Dakota now. Among those 14,000 members are employees who work in the home and community-based services area. And they work at assisted living, independent living, developmental achievement, all of those many services. I'd like to thank the committee for all you've done in the past for these folks. There have been some raises that have certainly helped, and I want to thank you for what you were able to do in this bill. But the people I represent can't be here today because on short notice with the staffing issues, they can't get the time off. So I want to tell you a little bit of their story. And I want to start with it. I want to talk about a developmental achievement center in northwestern Minnesota. And the hourly raises, I'd like to give you an example, a van driver who makes $10 an hour, a job trainer who makes $11.90 an hour, and a job trainer who has worked at that Developmental Achievement Center for 35 years and makes $13.85. Those numbers are a little abstract, so let me talk about them in a way that I hope will make them more real. The van driver makes $1,733 a month. If he doesn't have to pay income taxes, and he pays $800 for a mortgage, another $100 in property taxes and insurance, a couple of $100 in utilities, $300 for transportation, he has then $333 a month left over to pay for food, to pay for medical bills, to pay for clothing. The job trainer who makes $7.90 an hour has, after he makes those same payments, $663 a month for food, clothing, medical bills, and everything else. Several years ago, I had people come and testify from this Developmental Achievement Center. One of them talked about how she and her children lived with her parents because they couldn't afford housing on her salary. Another worked 6 days a week, 5 at this Developmental Achievement Center and another at a similar facility. She testified that when her husband was on layoff, something common in rural areas where work is often seasonal, that she and her husband fed the kids first. They didn't have enough money to eat. She said to the Senate committee, "It's really depressing to work 6 days a week and not be able to afford to eat. I also one time negotiated a contract for an agency PCA. She told me she couldn't afford to buy her clothing at Walmart. It was too expensive there. She shopped at rummage sales for her clothing. These employees work very, very hard, doing very, very difficult work with our most vulnerable citizens. The importance of that work should be matched with a pay rate that is commensurate with how important the work is. So I thank you for what you've been able to do. I hope you can help these folks both this year and in the future. Thank you.
Thank you very much. And so Mr. Weiberg, and then on deck is Ms. Payton, and Ms. LaCroix is going to maybe be the last one. So welcome to the committee.
Good afternoon, Mr. Chair and members of the committee. My name is Colleen Moriarty, and I'm the Executive Director of Hunger Solutions Minnesota. I had the honor of appearing before this committee earlier with my partners in speaking with you as regarding an increase for the food shelf program in the state of Minnesota. For many people, the economy has improved, but yet there are over 3 million visits to food shelves in the state of Minnesota every year. The funds that we had that our bill addresses would be an addition of proteins, fruits, and vegetables, and a unique partnership regarding diapers. I've heard diapers mentioned several times since the testimony this afternoon, the need for those kinds of funds, the need for people to have the kind of food that they can keep working, that they can get the job training. So I can't emphasize the point that there are Minnesotans, in fact, 3 million of them, 1 every 7 minutes, visiting a food shelf in the state of Minnesota, and they are depending on you to help meet those needs. Thank you.
Thank you very much. I appreciate coming in. Mr. Weiberg, thank you.
Mr. Chair, members of the committee, I'm Dr. Cody Weiberg. I'm the Executive Director of the Minnesota Board of Pharmacy. However, today I've been designated by the other executive directors of health licensing boards to briefly talk about the boards in general. And Kate Zackerpate, who's the Executive Director of Social Work, will also have some words to share as well. The 15 health licensing boards are all funded through fees that we collect, and we receive no appropriations from the general fund. But we fully understand that we have to be good stewards of the revenue we collect, no matter how whatever the source. To that end, we've long worked together to achieve efficiencies. One of those ways is by funding what we call the Administrative Services Unit, so that we can share staff that have expertise in contracting, financial matters, IT over the years, human resources. We've also, each of us, worked to automate our licensing processes and to provide online services to try to achieve efficiencies. And we believe we've done a really good job over the last decade or so in cutting the fat out of our budgets. So the requests that the boards have submitted this year are really meant to ensure that we have sufficient funds to continue providing our core services of licensing, complaint investigation, and the provision of technical assistance to the public, licensees, other state agencies, and legislators. We believe that all the increases requested really relate to the staffing and technology that we need, and that's intended to support this important work that we do. Just using the Board of Pharmacy as an example, if our requests for increased appropriations are not granted, there are going to be 2 impacts. We have one request that's related to the prescription monitoring program. We have a vacant position in that program right now that we'll be unable to fill. This is a program that is a pretty key tool in helping fight the opioid abuse epidemic. We have a more general request for the rest of what we do, and if that request is not granted, it's very likely that we'll have to lay off one of our inspectors, and we will not be as responsive to complaint investigations. Those will take longer, and it'll take longer to inspect the facilities that they have to inspect. And this is at a time when we actually license more individuals and businesses than we ever have in the approximately dozen years I've been here. And when, for our board at least, our complaints have tripled over the last decade, and they have become much, much more complex.
Ms. Zackerpate, welcome to the committee.
Thank you very much. Good afternoon, Chair Abler and members of the committee. I will do my best to add some additional information to Dr. Weiberg's testimony. Again, I'm the Executive Director of the Minnesota Board of Social Work, and we both do really appreciate the opportunity to give you more information about the budget requests of the 15 health licensing boards, including my agency, which is the Board of Social Work. Again, Mr. Weiberg really highlighted the board's core mission, which is very simple, it is critically important, and it is ensuring public safety for all of the citizens of Minnesota. Something you might not know, our boards and advisory councils are made up of over 200 Minnesota citizen board members who help direct the functions of the board, and they're comprised of both professional and public members who bring that very important expertise to our work. And we currently license almost 340,000 health professionals in Minnesota. So again, we have a lot of work that we do. A little more specific to the HLB budget requests. Again, I will highlight that all of the health licensing boards are entirely fee-supported. Again, we receive no general fund dollars, and so our budget requests have no fiscal impact on the general fund. All of the health licensing boards testified in the House of Representatives on our agency budget proposals, which was really based on the governor's budget recommendations. And those budget proposals and requests included, in short, things like small agency increases, staffing, education and outreach, strategic initiatives to better serve the public, licensees and applicants, so that the boards can actually be more proactive in providing our important services. Technology was included as well. And again, the boards have the funds to support the budget and the change item requests. And I do want to point out that out of all of the 15 boards, there were only 2 boards who requested fee increases. One of those agencies was mine. And again, just to highlight that with the fee increase requests, they have been vetted through and supported by the associations. We are not aware of any opposition whatsoever. For the Board of Social Work, it would be the first time in 17 years that we requested fee increase, and the fees that we're proposing are still lower than they were 17 years ago. Again, sort of as a wrap-up, the boards take our public safety missions very, very seriously. We ask your support. We hope that we'll be able to work with you to reconsider the budget proposal so that we're able to have the capacity and the resources to ensure safety for the citizens of Minnesota and address the critical workforce needs. Thanks very much.
Thanks. Senator Klein has a question.
Thank you, Mr. Chair. My question actually is not for the testifier. I do have a question, though, on something that came up earlier, if that's okay.
Okay, and just so people, we're going to move to discussion after the testifier, so we're not going to scoot out of here. So we have a couple more. Ms. LaCroix, and then is Mr. Franklin here from the Sheriff's Association? Hi. So welcome to the committee.
Thank you. Thank you, Mr. Chair, members of the committee. My name is Laura LaCroix DeLune with the Minnesota Coalition for Targeted Home Visiting. We are pleased that the committee is looking at identifying resources for targeted home visiting in the appropriation section 2615.15. We do, however, believe that the language in a bill carried by Senator Rolfe would allow for more flexibility and would allow for multiple model programs and non-model programs to receive funding or to apply for collaborative funding, and would encourage you to think about what we could do to increase family choice at the local level in which model best meets their needs and has the resources to meet those needs. Thank you for that consideration. I know we are short on time. I just wanted to encourage that flexibility and family choice at the local level.
You probably have 30 more seconds if you want to just ramble on. So okay.
Keep it short.
Thank you. Mr. Franklin.
Mr. Chairman,
welcome to the
Jim
committee.
Franklin, Executive Director for Minnesota Sheriff's Association. You have a very difficult task in front of you. I want to draw your attention to only 3 lines in the bill that occur on page 229.118 to 229.20. It has to do with the 48-hour rule. This would push those persons that have been adjudicated back into the jail for another 2 to 3 days by that 48-hour rule. We have to object to that only from the standpoint that we believe they should be in a care facility as quickly as possible. The second thing I would draw to your attention is the timetable, 12 o'clock p.m. on Friday to 8 o'clock a.m. on Monday. The 12 o'clock p.m. on Friday is already confused as to whether that is 12 o'clock noon or 12 o'clock midnight. Makes a significant difference as we approach that at that timetable. So again, our concern is we want to be on the record of pushing folks back into jail as opposed to into the health centers.
And thank you, Mr. Franklin. Just so to clarify, it's an issue of staffing safety. They can't staff up. That's the issue. And so maybe we can work on that. But it would be noon Friday because they don't know to plan for their staff and they're already short-staffed. That's the issue. So we can take it offline. I'll keep your card right here. Thank you.
Thank you, sir.
And there were 2 people are emailing. We got the technology. 2 individuals, Community Action, emailed, and they were very happy to be recognized in the bill for the fame and the grants. So with that, we're going to change gears. And Senator Kiffmeyer, if you're going to do this, and I'll change seats and we'll talk. Oh, I do just have a couple of reactions, and then members had questions, and some of them can be answered by staff, and I'll answer what I can, and Senator Benson, I think, is going to come back when she gets finished. Anyway, so just intention-wise, that NPI number, Fraser, I think, had the concern, that number, we didn't mean to have that in the draft either, because I never liked that in the first place. I do have a list of who's not getting reduced in the rate cut thing. So it does not include inpatient or outpatient hospital, does not include mental health services, does not include dental, does not include prescription drugs, does not include medical transportation, managed care elderly waiver payments, or the CD treatment fund. So those are out of that. And then I want to explain something else. And I've been here 18 years, and it's an honor and a real challenge to be in this position, and anybody who's been close to it knows that. And this is certainly a process, and in this bill we attempted to set out some priorities. The people with disabilities, the frail elderly, and kids in a number of ways, sex trafficked kids, kids with mental illness, kids that, anyway, that's been the effort to have those priorities be expressed. And there are gaps, as I'm fully aware, and no testifier surprised me with their comments, except my disappointment in not being able to do everything I wish I could do with my part, and then Senator Benson made her work on her half. And so this is a process. And so what we attempted to bring forward was a balanced bill that, based on choices and funding sources that people maybe didn't find desirable, but at least that it met the budget rules and it balanced. I had a draft of the House version, which is out now, and people will consider ours to be at least the tight version of that. But and in terms of the one item I just wanted to point out, on the 4% campaign, it's on my mind. We had, all along I had an increase penciled into every spreadsheet until Saturday, I think it was, when at the final fiscal note, the department said that the $30 million, $120 million item had to be addressed in that increase. And so whatever number I came up with, and I won't burden you with that number, although you're probably curious, it would have cost $150 million more to pay for a penny of an increase because they made us address this management budget assumption. And I would like to help people understand that this is not a small matter. The governor, I believe, is not going to be paying for that. There was a clear language, in my opinion, that paid for an increase in the DWRS area, amounting to, I think, $30 and $120 million over the two periods. And in an unprecedented manner, they ignored the plain language at MMB and did not put it in the forecast. And so putting us in the unenviable position that if we point it out, and you have to either, if you don't do it, you don't get any credit for not doing it. It just goes away. And if you do it as the plain language calls for, we're charged the $150 million. And so it's my position that it ought to go forward. What that does, however, is create a hole in the tails and in the November forecast. So it is a really hard problem, but I was kind of happy it was sort of ignored for the moment. But then when this PCA increase came forward, the department chose in their fiscal noting wisdom to add $150 million onto that, which made it just untenable. So it's still in my mind. There's still something to go forward, but I just wanted people to explain. Senator Laurie knows how things pop up at the end. You're like, good to go, and then like, what, 40 million more? Oh no. 150 million more is like, that was, we had surprises along the way. That was probably the singular worst surprise. So anyway, with that, I'll stand for questions I can answer. I know Senator Laurie asked for a listing of policy provisions in the bill. Maybe we could start with that, if that would be a leftover question. And between, I don't know if Mr. Monahan and Ms. White, is she at the, oh yeah, so Mr. Monahan, if you want to come sit in my chair if you want, and just so you can be here and ask questions. And so maybe Senator Laurie, if you want to ask your question, and then I'll yield to the chair to do what she does.
Thank you, Senator. Thank you, Senator Abeler. Senator Laurie, and then I'll have Senator Klein.
Well, actually, I was wondering when we were going to step through the policy provisions that are in here, just so that it's on the record while there's still a pretty good group assembled. It would be really helpful, I think, for the public process. And then another one of my questions, I think, was answered. So the issue with there being 30 million in 18-19 and 120 million in 2021 that will occur, that will be spent on home and community-based providers. If we do nothing, we did nothing, right, in this bill?
Senator Laurie and Senator Abeler, do you want policy to be stepped through before you have a discussion, or do you want to answer?
No, I think, this is part of the discussion. So I think it's a very legitimate question. And so we'll just take the questions that come. I've got all day. So this is what I'm here for. And so, Senator Laurie, to your question, this bill does nothing to address that, which in my opinion sends the money forward, but which creates a $30 million issue for at least for the November forecast. So we are silent, which means this bill supports that money going forward.
Senator Laurie.
Madam Chair, thank you. And so, I haven't really tracked the global budget targets closely yet, but did the majorities leave money on the bottom line, accommodating the fact that we didn't, that you're not going to change it, and so there's this extra $150 million that's known to be committed? You were on notice, we talked about it earlier a few times. You should make sure it's accommodated in some way in our fiscal tracking as we move forward. Otherwise, add to that $625 million shifted into the next biennium, another $150 million. I mean, we're talking real dollars here at this point. I mean, this is beginning to look like kind of a fiscal disaster. I mean, some happy people out there, but kind of a real fiscal disaster on our books.
Thank you.
Senator Abeler.
Senator Kiffmeyer, Senator Laurie, there's some other person who's a national figure who uses that word a lot, so just be careful. We'll be having a hard time separating you too. Sorry, that was just a bad joke. So I don't consider this bill to be a disaster. I consider it to be it's a thoughtful representation of the priorities that we have. And I do know that I believe there's at least $30 million on the bottom line of miscellaneous in our targets. I do not know what the tails are for 2021. And when Senator Rosen comes back, we could ask her to comment on those tails and what they're planning to do about that. I do, and just to be very frank about it, this topic will certainly be part of the last negotiations. And I'm cheering for this committee's side to win so that that money can stay on our side. So that's all I got on that. So.
Okay, thank you, Senator Abeler. Senator Klein?
Thank you, Madam Chair. Thank you, Senator Abeler. So I just wanted to go through something that came up in conversation earlier with you and Senator Hayden, Senator Lurie, so that I, as a new member, first approach to these omnibus spreadsheets, understand the language, and so that we are all speaking the same language about what a cut is, Senator Abeler, to inpatient care. And when I look at page 21 of the spreadsheet, line 716, there's numbers in parentheses, and you call it a delay to inpatient hospital rebasing, but Senator Lurie's been kind enough to talk me through what numbers in parentheses mean, and my understanding is that means less than forecast. We're going to keep $15 million over the biennium in state coffers that otherwise would have gone to hospitals. And I think it should be agreed upon whether that's a cut or not, and instruct me, I guess.
Well,
Senator Abeler.
And so actually the bill has two examples of either case. The rebasing is based upon a forecast increase that would go forward. And what we did was freeze the number at current. And so we spend no end of energy describing that as whatever we want to call it, but in my parlance, it's flat spending. And so if something is the same as it was, it's not a cut. But it is going to defy someone's expectation of what they thought they were going to get, and so off of their expectation, you could call it that. There is a rate cut in the bill of 2.3% that we discussed, where it's less than what it was. And that, in my opinion, is a cut. The entire budget goes up $2.2 billion or something off of the base. And so people gyrate either way as to what a cut is and what a not a cut is. So in my opinion, the hospital rebasing is just foregoing of an increase, and I would not call that a cut. The rates that we did 2.3% reductions on are, yes, that's a cut. That's my clarification.
Thank you, Senator Abeler. Senator Hoffman.
Thank you, Madam Chair. And Senator Abeler, thank you for, when you look at the overall bill itself, I think people should take note that it was, at least for your committee, it was done in a bipartisan manner that was pretty thoughtful. It's just unfortunate that at the end of the day, that thoughtful and wonderful experience is still bucking up against a system that wants to give tax breaks to those at the top of the ticket and forget about those at the bottom of the ticket. And I was really saddened by our inability to address the MA spend down provision that I still think is discriminatory to this day. And if there are any attorneys out there, it's something that I think, I'm trying to be funny, Jim, but that's what.
That wasn't really very funny.
It's just sad that.
Senator Hoffman.
For years we've talked about MA spend down and just how it's just that not really fair. It's same thing with about marriage equality. Even people with disabilities cannot get married in the state of Minnesota without paying a penalty. Matter of fact, if they get married, they lose their benefits, and God forbid they even have to say they're not married. They can't be together. It's really sad. But I want to set that aside and just kind of talk about the next phase. I did raise a question earlier regarding the Department of Public Health. Specifically, what I saw as two provisions that might scratch up the ladder on our response to the federal issues that we need to do, specifically healthcare indicators, health indicators. And so I don't know if folks had a time to chime in on that or give me the list of those, both on the preventive side and as the implementation side when it comes to Department of Health. And I was specifically looking at that Title V provisions that are in there and see where those cuts are. Did anybody have a chance to do that, Senator?
Senator Abler?
Thank you, Senator Kiffmeyer. The question came up, and actually I had not paid attention to that particular nuance. It's in the other half of the bill where I didn't spend as much time, but it's a valid question. I don't know if any staff have an answer that they can give us yet, but I know that by tomorrow we can get something for sure.
Okay, Senator Huffman to
does
follow.
staff know? Or?
Madam Chair, thank you. I'll stand aside and see if staff knows.
Okay. All right, Senator Isaacson
Madam
and then
Chair?
Senator Hayden.
Mr. Albrecht.
I'm sorry, Mr. Albrecht, sorry.
Madam Chair, Senator Abler and Senator Hoffman, I thought that this list from the Department of Health had been handed out to members. Apparently it hasn't, so maybe someone could make copies.
Okay, we'll have that done. Senator Huffman?
Thank you, Madam Chair. I just want to make sure I have time enough to take a look, because if we're touching, Madam Chair, on the 18 health indicators that we as a state, and those public health funds, those Title V public health grants, not just for one specific thing, but it moves a complete system of services around, and you would understand that with your background, so I don't need to preach to the crowd on that one. So with that, I'll hold off until later to have some more discussion, but I truly want to get that answered, and I just want to say thank you for the bipartisan effort in this work.
Okay, thank you, Senator Hoffman. We'll get some things around. And Senator Isaacson, I have you next.
Thank you, Madam Chair. So I came onto this committee a little later, and it's been a pretty steep learning curve, but I really appreciate that opportunity. And every day that I'm here, I begin to grasp the complexity a little more and more that we're struggling to kind of process our way through. And it's pretty amazing when you think about how many line items and how many little buckets we have to serve people, and how each one of those little line items, each one of those little buckets has an impact on some Minnesotan's life. And I think that's really important. What I'm struck with, though, is that in all conversations I've had with people offline, and all the conversations I've heard here, and all the conversations I hear just around the Capitol, people seem to have a pretty good grasp of what the problem is when it comes to our health care. And yet we seem to be unable to, or have the political will to solve that problem. People get that we're paying for things in a really backwards way, often Band-Aids and cure-based approaches rather than preventative approaches that actually prevent future problems from happening, you know? And I look at, we kind of pretend and we talk about this bill kind of like it's in a vacuum, you know, and the very gracious people that came to testify today were very kind, frankly, much kinder than I think they should have been when they look at and appreciate what we've done. You know, what you've done with this bill and what you've got accomplished and what you're able to give. But the reality is that this bill doesn't exist in a vacuum. It exists with a bunch of other budget targets. And what I struggle with is I've heard you on several occasions, Senator Abler, not you specifically, but you've said, these are the priorities we've laid out with this bill, doing the best we can with what we have. And I don't doubt that you are doing the best, and I don't doubt that Senator Benson is also doing her best given the very limited resources that she has. But what I struggle with is a $900 million tax cut, a supposed budget of $1.6 billion. You know, and for me, if you want to talk about priorities, it's what we do, not what we say. And the reality is that I have not seen the tax bill. I don't know if anybody's seen the tax bill, right?
Senator Isaacson, we are on the Health and Human Services budget bill.
We are. I agree. And I'm tying these together because they don't exist in a vacuum, Madam Chair. The reality is money we're not going to spend on this target where we spend elsewhere. We're saying that's more important than what we have going on here. The money, then we give a tax relief to somebody else, says that that's more important than the 7,000 kids that are going to be homeless tonight. It's more important than the waiver system and the fact that we're not paying our employees that take care of disabled folks enough. There is a serious list of things we're saying those tax cuts or any place else we spend money are more important than this. And I would hope that the folks in this room that sat through the testimony that was tear-jerking and heart-wrenching over the last 2 months would maybe stand up and say that that's just not going to work the way it is. And I get it, it's part of a process, and we all throw our best versions out, and we're going to come back and negotiate. But that's the second problem with this bill. That's the second problem, because the second problem is we're going to negotiate a bill that's going to go to conference committee, and in conference committee, it's going to get worse. Because if you've seen our bill and you don't like it, you're going to hate the House bill. So it's only going to get worse, and then it's going to go to the governor's office, it's going to get vetoed. And then it's going to come back and be reworked, and when it gets reworked, it's going to go back to a conference committee, and now we have even less transparency and a smaller group making bigger decisions. And that drives me crazy. And while I'm trying to catch up and learn about all the waivers and the TANF funds and MFIP and all that stuff, and I'm doing the best I can, I think the bigger part of it is that sometimes it feels like this is just a little silly to sit here and posture like this, when really we're going to pass a bill that we're not going to like. It's going to be worse when it gets to the House, and it's going to go to the governor and probably get vetoed. And that just is a struggle for me. Now, I don't believe that you're not earnest, Senator Abeler, but I struggle with what fundamental message we're sending about a very broken system. Thank you.
Madam Chair.
Thank you, Senator Isaacson. Senator Abeler.
And for all the things you just said, that's why I wanted to be a part of this committee. So I'm glad you're here.
Thank you, Senator Abeler. Senator Hayden.
Well, thank you, Madam Chair. And so it almost sounds like we're getting to this part where we're going to surmise the bill and tell you, kind of why we like it or don't like it. So before we get to that, I know Senator Lurie had talked about before. I do think it's important to walk through the policy provisions, and I know you do too, Senator. So, I know this isn't Congress, but I'd like to reserve the rights to comment on some of the problems or things that I think work well with the bill, but I'd really love for us to have a full context of what you're proposing. So if there's the ability for us, Madam Chair, Senator Abeler, for us to walk through the policy provisions in the bill that changes, I think that would be great.
Thank you, Senator Hayden.
Well, that'd be good. And I think actually
Abeler?
if I can rely on staff to kind of walk through, I have, we've been here for a little while, a number of years, and the staff continues to amaze me with that they remember all this stuff. And they point out, oh, this is mine. And so I think if there are versions at least that are largely policy, a lot of these are kind of interrelated and they're going to make a difference. But staff can at least help us with what they judge to be a policy question. I'll accept their judgment on going through the list, and maybe we can just start in the beginning and kind of walk our way through.
Okay, thank you, Senator Abeler. But just 1 second, Senator Lurie, I had you next on the list. Is it to this point or something else?
Well, actually, if we had some sort of a handout that would help us track the policy, it would help a great deal. I mean, maybe it could come afterwards, but just...
Senator Lurie, I'll have staff respond to that.
Senator Lurie, I mean, we got this request at 6 in the morning. So we have been trying to get a list together. It isn't finalized. We can give you it unfinalized if you want, but, it's up to you. I mean, we certainly have a list that is pretty close to being finished, but.
Well, and I need
Senator
to be clear,
Lurie?
I'm not laying this at the feet of staff,
No,
who
I
I have a tremendous respect for as well. But this is an omnibus policy bill as well as an omnibus budget bill, and we don't have a listing of the policy in it. I mean, that's really a big problem.
Well, Senator Lurie, let's let staff go through some of it now.
Okay, so we're going to go through some of it.
Well, Senator Lurie, we're going to go through
without any
it.
handouts. Again, I'm not going to lay this at the feet of staff, but
Senator Lurie, Senator Abel.
Well, Madam Chair, I think there's this thing here. Oh, never mind.
So, Madam Chair.
Senator Abeler.
I'm good with whatever the committee wants, Madam Chair. And I don't want to put undue burden on staff, but it's mostly related to the money, and there's some,
Madam Chair?
So, Madam Chair.
Just a moment, please, both of you. Just a moment.
There will be a final list tomorrow, but to Senator Lurie, the bill is mostly related to finance. That's why it's small. It's kind of anemic when it comes to human service bills. But there's a few, like Senator Hoffman has a couple, like 2-paragraph things in here. And I think the most interesting bit of policy is the insurance article. That's probably the most one that any policy that's in here is like not objectionable, except for that insurance one probably, which you might have some, I know you had concerns about that, but in looking at what we put in here, that's related totally not to fiscal. It's, on my part, I think there's nothing unusual or controversial, but it's that insurance part. That's what I got to offer you. But
Thank you, Senator Abler. Senator Laurie, did you want to?
So, I guess I'll just sit and listen to whatever we have. Back to the point on cuts, though, before we move off of that entirely, that basic care cut, I do believe, does include services provided at Children's Hospital, the therapies provided at that hospital. One of the hospitals that sees, primarily disabled individuals and a really high percentage of medical assistance clients, and so
Senator Laurie,
they are
Senator
therapies, not inpatient or outpatient, but coming back to that point.
Senator Abler.
Well, just Senator Laurie, it was, Madam Chair, Senator Laurie, it was our instruction that it not include any hospital people, not inpatient, not outpatient, and not that list. I'm just telling you that's what our intention was with this going in, and so there was a fair amount of time spent one evening trying to actually there was language and there was a spreadsheet number and the language didn't match the spreadsheet, so that was our intention, that it not include any. And so it's my belief that it does not, based upon everything we were told as we were working on this. So I'm just telling you what we intended, what we didn't intend. And if it does do that, then we'd better find out, but I'd be surprised that it would.
Okay, thank you, Senator Abler. Senator Hoffman.
Thank you, Madam Chair. And I went and got the answer to my question, Senator Abler. So, okay. I know this didn't come through our committee; it went through the other committee. Now that we're combined, but I think it would be important. Under the Social Security Act, Title V was established to help look at, it was young babies and moms back then, and each state gets an allocation of federal dollars as long as they do programs that are going to benefit these health indicators that are established both federally and statewide, and that's what I just brought up. And so in this 7% base reduction impact that I got from the department here, and I'll share this with folks, but there are clearly some programs that have some federal strings attached to it, Senator Abler. We want to make sure that we're talking with Senator Benson about, and I'll give just for example, when you look at birth defects information, child and teen checkups, children and youth with special health care needs, one of the things that was authorized 80 years ago under the Social Security Act, specifically Title V, and Section 501, if you want to start there, it talks about that 1/3 of all services and 1/3 of your health indicators in the state must be geared toward youth, children and youth. They use the word special health care needs, but it's children and youth with disabilities. So, and then, when we get the child and teen checkup, fetal alcohol syndrome, home visiting, those are all, maternal child health, those are all connected in there. So somebody from research needs to sit down to say, we just don't have a fiscal, when we look at cutting or having a savings on the state, there's also a federal attachment to that might be more than what we anticipate. And so I would hope that somebody can answer that question. And I'll just be a real example for you on, for example, on if you look at the children and youth with special health care needs, even though the forecast is 320,000, the 7% base reduction is 22,000. Well, that just gets eliminated. Also, the federal dollar, it could be upwards of $100,000, and so each one would show that. And if you have 18 indicators of that, 18 times 100,000 is a lot of money. So I think we need to be, before we move forward on this discussion, somebody needs to flesh out what, and not to say the other committee, whatever that committee, the Human Services Committee was doing, but I want somebody to look at that, Senator Abler. Does that make sense?
And Senator
Thank you,
Hoffman,
Senator
in our
Hoffman.
committee, we do call it the
Senator
other committee.
Abler?
We don't refer to it as when I was listening to that H word, it's the other committee. And I wish Senator Benson were here now, but I will take this up with her.
And Senator Abler, that's exactly it. Senator Benson is not here right now, but she will be going through this all with you, and to let you know that the entire language was posted last night. And so the staff did have to have a few hours of sleep, And so they're back here today, and they will be working hard to go through this and make those policy lists as you have requested. And so I think it's only appropriate to give them the time to do so, and it will be posted. One thing I would ask, as soon as the staff does have that ready, that you just send out a notice to the entire committee. I think it's pretty customary to do that, to let them know that that is the case. And my understanding is tomorrow morning at what time?
10.
Tomorrow? 10 at 10 a.m. There, in this room, there will be a complete walkthrough of all of that with all those materials. And your questions, Senator Hoffman and others, Senator Hayden, I will call on you yet, that particular question they've taken note of, and so they'll deal with that as well, my understanding. Senator Hayden.
Good. Well, thank you, Madam Chair. I think that, and I appreciate the update that you just gave us. I think it begs the issue of why we're kind of rolling around in a circle, is that we need to have the information in a way that it's predictable. We need to have the information for us and the public that we know when it's coming. And I have personally felt uncomfortable all year long in the way in which we've been able to kind of present this. And that's with all due respect to you, Senator Abeler, and the chairs. You know, this process should be as such to where we know exactly what we're going to get and when we're going to get it. And if we don't have it, we should wait for it. I understand, and with all due respect to Chair Rosen and the work that she has to be able to do with the Finance Committee and us being able to be orderly, but it is important because we're asking questions that seem to be out of context, are questions that might have been answered if we had the information up front and was able to go through the process. You know, I have a question on this issue of child care assistance, and we're going towards a federal conformity rate, and we're looking at upping the rate relative to market rate. But if there appears to be stuff in the policy bill that we haven't gone over, but it didn't show up in the spreadsheet. So that could be a good thing in getting providers more money, but a bad thing because we only have a set pot of money and we can increase and grow the waiting list. I don't know if that's exactly aligned. I think we'll find out here soon as we go through. I also think, Senator Abeler, that let's not assume that things that seem to be agreed upon or maybe agreed upon with certain parties, that other people may not have issues with it, other members. There could be other members of the like, for instance, I know there seemed to be some widespread agreement on the child care assistance regulatory piece to cap it at 25 people. I think that the department felt like they had some widespread agreement on that in the community, and we have multiple community members show up today and contacted my office and others to say that they didn't. So the reason why I say that is because we really don't know unless we go through the bill in a predictable way. And if we don't do that in a predictable way, and if we shorten debate and we curve members off of that and don't give us an opportunity in the minority, that is what we have, Madam Chair, is the opportunity to raise these questions. We don't have the votes unless somebody changes their mind, but typically we don't have necessarily the votes always to stop kind of what goes through if it looks like that's his pathway, but we do have the opportunity to raise these issues. So I do this in the most respectful way of saying if we can have this in a clear understanding of here's the, because we did do, you guys changed the structure, which was fine, but to have policy and finance in two different parts of the HHS, we're hearing the policy now, and you put one big bill together, and I was fine with having the, joint committee and put us all together. But in that, we are going to have to be able to really understand what are all of the policy provisions. It would be helpful to have that in front of us. I mean, I guess we could look at the bill while we're going through that so that it jogs our memories or jogs other memories of what we're doing, line that up with the things that are funded and not funded, the things that have fiscal implications or not, so that then we come out of there one way or the other, whatever decision we make, yay or nay, we actually know what that is. Senator, I've been in the room when we were the majority party and making and putting these bills together, and often you are talking to each other, and it would be untenable to bring everybody everybody in the room in which to do it. That's not our custom, but now is the time for us to get together and to walk through this kind of piece by piece in a way that is organized so that we can figure this out.
Thank you, Senator Hayden, duly noted. Senator Hoffman, one more comment?
Thank you, Madam Chair. I forgot one more. I wonder if somebody could help me understand when Kate Zacher-Pate got up and talked with Dr. Weiberg on the licensing board activities. There was a question that came to mind, is that the health boards have zero impact on the general fund, yet we're booking savings. I guess can somebody help me understand, if there's zero impact, why are we looking at some cuts, or are they not really cuts, like they're not on the formulary? I mean, how does that help? Because I'm having a hard time clarifying that comment, so help me understand.
Thank you, Senator Hoffman. Senator Abler?
Well, thank you. And
Or Mr. Albrecht can...
go ahead, Mr. Albrecht. They need a different voice.
Well, Madam Chair, Senator Abler, and Senator Hoffman, I don't have a lot to offer because I just noticed that change this morning. There must be a revenue loss, I'm guessing, in the state government special revenue fund, but I haven't tracked it down. I do notice that the governor's number matches ours nearly identically. But I can't explain to you exactly what proposal is producing that result. But I will.
Thank you, Mr. Albrecht. We'll get that information more further and just to mention, members, probably one of the best things we can do is let our staff go back to where they do a lot of this work in their offices, and I think the sooner they do that and get that information that you want, they can do that.
Madam Chair.
Senator Abler.
And, I'm in no hurry to leave. I'm happy to sit here and discuss everything. And if you, in terms of our half of the bill, and by the way, I just want to comment, the system that we had really worked well. From my point of view, we were able on our committee to go deep into DWRS and DTH and WIOA and acronyms to just stimulate your mind and prevent Alzheimer's from getting onto us. We talked about the Focus on 5, how do you treat a child who's 2, and all the programs that could be joined there in Dakota County was helpful. And I think that was the point of having these 4 bills that we had as kind of placeholders. So we tried to create our bill out in front of the open. And so when you see what's in here from those, there should be no surprises. I think the other language in the bills, and it might be helpful to have a list of the bills that are in that might be a helpful thing for members. And to see what bills were included that were not related to the spreadsheet. But I think virtually from our part, with the exception of MinChoices, which we discussed at the end, which I worked on longer than you would think for how little product I had until just now, there was nothing that I can think of that was put in that was not heard in our committee and laid over or kept because it was just decided that it's going to go with us. And I think on the other half, there was some language that's of Senator Benson's project about the supplemental rates that came up late. And the insurance stuff, I think, was all in committee. So I don't think, compared to some bills, I remember in 2011, we were really pushed, and the delete all was full of things that people had not seen as much. I think that's not the case here. I think as people review when they get a chance to look it over, I think they'll find it to be things that have been heard with very small exceptions. And so it's curious that in the name of transparency, we've made it more complicated, but that was at least the things that are the hard things that are in depth were trying to be discussed out loud. So.
Thank you, Senator Abler. As I read through the bill as well, I saw many things that were parts of bills that we had heard in the committee. I heard a Senator Jensen or Klein. I'm not sure. I can't see.
Thank you, Madam Chair.
Okay, Senator Jensen. I couldn't see whose hand was up from the curve of the bench. I'm so sorry.
I appreciate all the comments made, and I appreciate the angst, because I think everybody in the room would like to be able to do more. But when I go back and I look at the biennium of 2014-15, we spent approximately $11.5 billion. And I look at the same sheet that I'm looking at today from 2016-17, and that year we spent $12.5 billion. So it was $11.5 billion, then $12.5 billion, and then this one is about $15 billion. So, I think, I know that I'm a freshman, I get that. But it's still, it's 11.5, 12.5, 15. And some of those, I'm sure, are due to tails and obligations that we have going forward. But we still are spending more and more money on health and human services. So I think that there's some value in being aware of that as well.
Thank you, Senator Jensen. Okay, Senator Laurie.
Madam Chair, to Senator Jensen's point, and also to bring in some of what Senator Isaacson was saying earlier too, that's true. We are spending more and more money. The trouble with this bill is that we're using one-time shifts and gimmicks to cover it, and I mean we really are, and pushing huge expenses out into the tails beyond our fiscal view that's available on this spreadsheet, and we didn't accommodate the $150 million across the 4 years that is known to be spent, and we're doing it within the context of a global budget that's proposing tax cuts. My fear is we're adopting a budget that is full of promises that we're not going to be able to keep, collectively. Honestly, we've heard from a lot of folks here today who are pleased with the limited view that we have of the budget and some of the things that were able to be accomplished here, but it was accomplished with, one-time money for ongoing needs in a way that really sets Minnesota up for fiscal disaster. And in a way, and it's odd that I'm sitting here being the fiscal conservative. I just need to call that out too. I'm just going, come on, I'm supposed to be the tax and spend guy,
well, Senator
but
Laurie, we should have you do this more often.
You guys on spending in a way that is not responsible to our budget and our ongoing commitments. Whatever promises we make to these really important needs across the state of Minnesota, I want to be able to say, yeah, we have a structurally sound budget proposal, which is hard to do. I mean, believe me, I know. I have been putting them out for years. And it's important that somebody does that, and that's been the history and tradition, the role of the Minnesota Senate to put out, the fiscally responsible budget and go into committee with one that actually structurally works and makes sense and sets the state up for the set of proposals that we believe we're able to actually maintain. And I believe we're a long way from that in the budget that we have here. Some good things. We heard about a lot of them today, but I'm left with a great deal of nerves about the manner in which these things were paid for.
Thank you, Senator Laurie. Mr. Albrecht? We have some questions that I think you wanted to respond to.
Madam Chair and Senator Hoffman, I found the explanation for the reduced spending that you noticed on the statutory funds, the dedicated funds, line 13 on the front of the page spreadsheet. And it's related to the substance use disorder reform proposal, which begins on page 19. And if you go to page 20, you'll see that there is revenue going into the CD administration account, and that is the federal share of some payments to the state are being diverted into the CD fund. So with that, and then on line 678 is some spending in that same dedicated fund. So the net is the amount that the revenue exceeds the expenditures in a dedicated fund.
Thank you, Mr. Albrecht. Senator Hoffman?
Thank you, Madam Chair. And that's specifically relating to the board comment or the Title V dip into Mr. Albright?
Mr. Albrecht?
Madam Chair, Senator Hoffman, that issue that you asked about at the Department of Health, I don't know the answer to yet.
Okay. More information will be coming, Senator Hoffman. But at least you got your down payment. You got the down payment, so it's very good. Thank you, Mr. Albrecht. All right, members, so with that, seeing no further discussion, Senator Benson? Senator Abler?
Madam Chair.
Senator Hayden?
Madam Chair, I thought, I'm not sure, but I thought we were going to go through the policy provisions of the omnibus bill.
No, Senator Hayden, it is my understanding that the staff are not prepared with a comprehensive list, and so it would be posted as soon as they have it ready, and then it would be walked through in the committee tomorrow morning at 10, where you can answer questions. It'll be fully posted as soon as the staff have it ready.
Okay, all right. Well, thank you, Madam Chair.
Thank you, Madam
You're
Chair.
welcome, Senator Hayden. All right. So with that, Senator Benson, Senator Abler.
We've finished our committee's business for the day. We'll begin markup tomorrow morning.
Markup tomorrow morning. All right.
And Madam Chair,
Senator
Commissioner
Abler.
Piper could not come today, so she'll be there first thing as well, I understand. So
Okay, we'll make sure that
just
that
we can look
is
forward to
on.
that and then the rest. So thank you, members, for all your attention and for this process, and to all the public for all their engagement. It's good they're here.
Thank you, everybody. And with that, members, we are adjourned.